as a male and man and woman. It prepares the body for copulation with the teenager when they reach puberty. Sex education, including in a spiritual aspect, should be the part of both health and moral education from kindergarten through grade 12, ideally carried out harmoniously by the parents and teacher. Involvement of spirituality and emotional status in sexuality is a must. Otherwise, there is no difference between the human being and the creatures which are in the planet. Sexuality in life. Education about sexuality is often held as taboo in Indian culture since Victorian era. उसके पहले देते थे, अंग्रेजों ने आके हमारी सब चीजें बंद कर दी, अब वापस चालू हो गई. मैं आगे स्लाइड में बताऊंगा आप. Sex education in India is poorly implemented. Today it is clearly at the crossroads. Imparting sex education is both science and an art. Need the educator to be properly trained. There is a huge unmet need of sex education in India among the youth to keep pace with the age of information technology. Effective sexual education can provide age-appropriate, culturally relevant, and scientific accurate information. So it is more of scientific. There is a crying need to relieve the eloquence that our forefathers had at all levels of society, openly discuss the various aspects of sexuality. You can see in Khajuraho and Konark that what our forefathers had left for us to educate our children, but we still afraid of talking. Sex has many purposes. On the surface, it offers physical pleasure, release, but not all, but it promotes the spirituality. Sex can also help partners connect emotionally, building intimacy and the trust, which is a must. Some people view sex as not as a physical and emotional experience, but a spiritual one too. Spirituality sex leads to the deeper spiritually fulfilling connection with the partner. Spiritual sex study shows that society should remain cautious from the person who is spiritual. They can be sexual. Platonic people who hide their sexuality under the shelter of spirituality. There are many examples in the country. I will not name anybody. Atomic sex. There is a divine truth behind the sex. We see sex exist in many levels. Physical level, we are aware of it. Definitely, there is a law of attraction which operates. So in sexuality, it is one of the first stimulus. It does exist purely physical bodies coming close to each other. There is a physical component in the sexuality. Apart from the physically, there is a nervous element in the sexuality which is called sexual itch. An itching sensation in those parts very physically, which brings up the whole cascade of event and brings up to the whole thing back to the forefront. Sexuality and spirituality, the one river and the two stream. The flow of energy that connects us in amplified when we honor our body and the body of others. Exploring and expressing sexuality is a spiritual process that deepens the relationship with others. Sexuality as a central aspect of being human throughout life. Sexuality is regarded as a very normal, universal force expressing itself through the countless forms. Sexuality encompasses sex, gender identity and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. Sexual health. What is sexual health? Family life education teaches the role and responsibility of male and female toward each other in all relationships. Public discussion of topic of a sexual nature are widely considered as taboo in Indian society. 9 Indian states have banned in schools. The traditional Indian psyche will need to be approached tentatively with the psychological insight when challenged. Sex is very normal, natural, healthy phenomena. Sex is a procreation and for recreation both. Thanks to Modi ji. After years of sex education being banned in many Indian states, Prime Minister Shri Narendra Modi ji rolled out as a sex education program in 2018. What is the sequence of trained in the sexuality in India? अगर पुराने समय में देखो तो रंग रंगेलियां होती थी, होली के टाइम पे एक दूसरे को रंग लगाते थे and that was also, and they were attracted to each other, that was also a sexuality. That doesn't mean that sex, a physical sex, but it was a sexuality. But The era has changed. The clothes have changed. Pattern of the clothes has been changed. See the girl in the school. See the lady in the marriage. See the person like Salman Khan showing his body, kissing on the roadside because of a lot of the hostels in the country, because of the educational hub. In every city and the village, people are coming for the education, and they are not guided by the parents, not by the guardians, not by the wardens, and they are involved in sexuality and leading to premarital sex, which is increasing in our country. Kam Sutra pornography. Swadhisthana Chakra. It governs both reproductive organ and imagination. It is stimulated during pornography and act in the two ways. Creative for society, expansion of family. Destructive as a male cannot control themselves, so they act in two ways. Either they will masturbate, abstinence, or they will do rape because they want to be relieved. If it's female who should care and save themselves, so life skill education should be implemented extensively in the school. Just see here the sacral chakra, that is sexual creativity. Loss of losing virginity. Children are sexually active by the 14 year of age, and they are more of the virginity is losing from 16 to 20 years, that is 83%. When I was talking in one of the engineering college with the student, they were from 18 to 22. When I asked what is virginity, so one of the students say that it is a loss of opportunity. So that is an indication that most of the children, 83% children, are losing their virginity before the marriage. GOI, Government of India is raising age of marriage by 21, and adolescents are in hostel career oriented, or they are career oriented. What will happen? Rape cases in India, 12 to 18 years. Out of 33,000 reported victims in 2013, about 30% of the victims are children. They are from 12 to 18 years. So that shows that sexuality education in school, in the society, by the parents is a must. Need of hour. It will decrease the negative hazard of sexual behavior like unwanted, unplanned pregnancy or infection. It will enhance the value of relationship at decision making and opposite gender. It will eradicate the lack of knowledge and create right attitude in adolescents. 300 million youth from 12 to 14, 24 are revealing their commounting preferences for premarital sex. I have shown you in the previous slide. Shatter the silence, take care. 53% of children in India are sexually abused. 72% of the children do not talk about it and suffer in silence. It has been shown in one of the TV show, a majority of these children have been abused by the people known to them. तो बच्चों को ये बताना जरूरी है कि आप बाहर सड़क पे तो असुरक्षित हैं, आप अपने घर में भी असुरक्षित हैं. You need to take care. 62.4% of incest survivors are abused between age of 10 to 18 years. So घर वाले भी नहीं छोड़ रहे हैं. 32% of incest survivors were abused between the age of 2 to 10 years. 87% of incest survivors were abused repeatedly because they are living in the family with the children. 19% of abused were currently living with at least one of the abuser. जैसे बचपन में भी मेरा यौन शोषण हुआ था. It is the दिवंगत सतार वादक की बेटी बोल रही अनुष्का. And the latest of 2020 rule, भारत में बच्चों के ऑनलाइन यौन शोषण के 24 लाख केस. Status of Indian adolescent. 0.5% teenagers get information from the parents, while 67.5% get from media and connect. So it's a very poor status. 42% of the students got their first dose of sex-related information from 11 to 15 years. And by the 14 year, they are sexually active. 6 Indian states survey shows premarital relationship by the age of 15 years. Children are getting hooked by the pornography from class of 9th onward, and even in the school premises, and has become big issue from the school authority. You can see the picture, how the children are meeting and how they are saying bye-bye, goodbye. Why sexual education is important? Adolescents are exposed to great deal of information from social media or from friends. They need to learn facts about human sexuality, Teenagers are hungry for the accurate and adequate information. Sexual expression is a basic instinct and a need. Once they are caught in the net, they can never come out of it. 1/5 of the world population is between 10 to 19 years. Age of puberty has decreased because of better nutrition in our own country. Age of marriage has been increased because of the children are going for the jobs. They are more career oriented and they face long gap between the two. So they are involved in the premarital sex. Young people indulge in sexual activity early in life, not aware of the consequences of their behavior. Everyone has a sexual feeling. As they mature, they are sexually attracted to other people. Recognizing sexual feeling in which gatekeepers can help teenagers. You should be willing to discuss the power of sexual feeling and difference between the feeling and doing. If they are talking about sexually, that doesn't mean they are doing the sex, they are involved in the sex. What good time to talk. There is no magic number in terms of age, but you parents should be cautious from 9 to 12 year onward is the best time to consider physical and psychosexual maturation of the children. If the child is mature before the 9 year, definitely you should impart sex education to the children. If they are late, definitely you should impart sex education late. Body changes to be explained. This is excellent time for gatekeeper to begin discussing about values and belief about issues such as dating, which is increasing. Relationship, children are living in relationship without marriage. Wet dreams, premarital sex, they need reasonable amount of privacy and truth. Sexual feelings are stronger. They are less able to discuss issues straightforward and better way to encourage them for talking. Behave and respect teens. Knowledge and equipment won't encourage teens to involve in a premature sex relationship. Stay calm. Don't over-romanticize sex like blooming of roses, fireworks, supreme, spiritual. Don't scare your child that you will bleed, it hurts, or it is terrible. Stress that no matter whatever happens, you are there. Mahuna. In any case, you are there to help the children. Facts and value. They want to know the facts about sex and family value. Facts are facts. It doesn't involve value. It is everywhere in the planet. Facts about the sex. Physical sex is same. From animals to the human being. But values are important. Values are different from people, from family to family, depending on cultural heritage. Be honest, say what you believe. What you value, don't say what you are not sure about. Motivate them to delay sex. Gatekeepers need to direct their teens towards self-empowering goal. Teach proper boundary. Lakshman Rekha. Never forget our own epics. There's a lot of saying in our epics, but we just run to the west, which is west. East is the best. So give your education through our own epics from the short stories to the children. Should keep them busy with the alcohol, school, work game, volunteer, social and spiritual work. Unconditional love and support. If the teenagers do not get love from their parents, they view sex as a way to get it. Best way to keep them away from the peer pressure is to raise their self-esteem. Spiritual interconnectedness is associated with the lower likelihood of volunteer sexual activity. Building self-esteem of the teens, it is important that it has influence on the sexual development and making important decisions. Less likely to be under pressure for unwise choices. One should appreciate their talent, personality, look, accomplishment without any comparison. Treat them with the respect, listen their ideas and feeling, think about what they say. Don't cut them off when you disagree with them. Self-respect begins with the respect and consideration you receive from you and others, knowledge and power. They have got right of information to take. They need respect and they are to take the responsible decision. Discuss the right time. Your willingness to talk openly about these subject will make it easier for teen, male and female bodies, menstruation, erection, self-stimulation, sexual love, what it is, good touch and a bad touch, pregnancy, cultural belief and birth control. It is good that the print media is now routinely coming out about the good touch and bad touch and to educate the children. That is a very good step by the government and the print media. Teenager needs to know desire is one of the joy and wonder of being human, but it takes long time to know about how to handle it. Sexuality is a natural part of adolescence, though it does not necessarily mean beginning of sexual activity. Any sexual involvement should be by the mutual consent. When talking about the sexuality, follow the teen's lead. What the child see into the face, see into the eyes of the child. If the conversation is not in the right direction, even express your values and fact, but do not lecture. They need to know about birth control, supply to practice safe sex. In America, the parents can give condom to the children, but in our culture, it is not required and it is not advisable. When not to talk. It is not better to talk about sex if the conversation seems to be tense, unpleasant for the adolescent in the public place or the friends are there in the middle of the family argument or crisis. When you are extremely embarrassed or fearful about sex, when you are experiencing sexual problem in your own marriage, when child refuses to do so or appear extremely nervous, this can be sign that child possibly is sexually abused. Gently assure him for telling you, reassure you love as before, main hu na. If they don't ask, don't let their silence you to talk. Show that it is okay to talk about sex issues by talking with you, spouse or other adult when children are around. See when it is appropriate. Go to one of their movie, watch one of their TV show, listen to their music, open the door of discussion of sex and values, comment, is sex related event in everyday life, notice a pregnant friend or condom and personal product, it is good time to start talking. Abstinent, right, a positive approach. While teaching sexuality, accentuate the advantage of delaying sexual intercourse. Acknowledge them. Physical intimacy between the two loving adults is beautiful and joyful. Teach them many things. Many during dating couple decide to practice abstinence rather than regretting in the future for loss of virginity. Best way to avoid sexual pleasure is to anticipate and discuss it. Teens likely to have sex if they are enter puberty early, so you should be cautious when the child is prematurely in a puberty, precocious puberty. Socialize with the youngster when appropriate and encourage their sexual activity. Place little value on education. Have poor relationship with their parent, particularly with the father, because whenever they talk about sex, father usually will not talk and they will say talk to the mother. She can teach the daughter, but not to the male child. Rarely attend religious program. Role of gatekeeper. They need to talk and affirm as they are primary source of information and guidance. Teens develop positive, healthy attitude about sex with authentic information. Positive communication helps to establish individual value and healthy decision. Teens needs to have teens need to be taught against sexual exploitation, sexual aggression, guilt feeling associated with the feeling of wrongdoing. Advise them to wait for the chance to have sex with the legal partner in the future date. What happens when we don't teach boys about the sex? Which is surely conditioning male brain towards the unrealistic secretly, and that the other teacher becomes a porn teacher. Masturbation. It is beginning of pleasure. Analogy of masturbation offer insight of education of our sexuality, knowing how to love and experience pleasure even with ourselves. It is an inborn skill than knowing how to solve algebraic equation. It is most common sexual act offered a root of understanding of our sexual anatomy. Masturbation recognized is essential truth that we are all sexual human beings. Masturbation continue to carry religious taboos. Masturbation is the only sexual practice that most people can do and do enjoy throughout their lifespan. 100% men masturbate while women 82%. It is a practice of solo sex and teacher of both gender. 2007 studies show that male masturbation may improve immune system and health of prostate. In women, it builds pelvic floor muscle and sensitivity. It is a stress reliever and a sleep aid. What is sex then? Love is vertical. Sex is horizontal. Sex basically means gender, that is male and a female. Sex is normal human response. How it can be taboo? Because of sex, we are all here in this planet attending this webinar also. It is a difference in the body structure which separate and attract each other. It also means sex appeal, the attraction that draws male and female to each other. Thus, sex have both gender design and copulative connotation. to enhance sex education. Starting sex education at young age can normalize taboo effect. It curbs the spread of misinformation around the sex and sexuality. Comprehensive sex education can decrease cases of sexual abuse, which are increasing day by day in our country. It can help to a healthy attitude toward the sex and sexuality. Explain when you are talking in the school about with this diagram about the sex organs. This is a better way of explaining. I got this from the net. It's a very good diagram on the cloth. They have shown the vagina, uterus, fallopian tube, ovary, everything has been shown in this figure. It is very easy to explain to the female children. How to impart sex education. When we are talking about children, we should talk about the premarital sex. This is a very good aid by the government of India about the AIDS to prevention of AIDS. When the children are in, when you fix this, can be fixed anywhere in the choose for this aid in the first socket. It is a premarital sex. The second socket is a parital sex, and the third is an extramarital sex. Unsatisfied or powerful purpose of 53% female and 43% male in extramarital relationship in India is increasing. Hazard and risk. Sexually transmitted diseases, unintended pregnancy, emotional upset, unplanned parenthood, immature relationship leads to risk, feeling of hurt, jealous, and a pain of broken heart of being used. Just a minute. By the age of 16 to 17 years, 2/3 of our teenagers had been involved in romantic relationship, which is increasing. Teaching methodologies in the school. Present curriculum is not properly designed. Schools should have counseling facilities for value-based life skill education or to the safeguard adolescent. It should be taught in a small group by the same gender. It teaches to avoid embarrassment for the both student and teachers in Indian culture. It is better if the pediatrician and adolescent physician, school counselor are involved to dealing the responsibility of teachers for the imparting sex education. Human sexuality and spirituality. That's the physical aspect. To enjoy beauty is not a sin, but not at the cost of someone's discomfort. The mental aspect, giving time, finding happiness in making partner happy. Spiritual aspect, do not hurt someone if possible and do not hurt yourself also. Maslow need of hierarchy 1943. What they say? Physical and sexual need, safety, love and belonging, esteem, self-actualization. This is the Western psychology. What is the Eastern philosophy? Root chakra, sacral chakra, solar plexus, Anahata chakra, Visuddha chakra, Anjana chakra, and Sahasradhara chakra, crown chakra. We are on the top of the world by the Eastern philosophy, and we are more spiritual. 14-year child is sexually active is a normal phase. But if 14-year child is involved in spirituality, is a wonder. That is the birth of Buddha, and Buddha has gone into spirituality by the age of 14 years. Our own institution of sexuality and spirituality, place of learning sexuality and spirituality, unique monument on the planet, nowhere in the world. Inside of spirituality, it is a path of opening the 10th inner door of conscience of spirituality after satisfying 9 doors blessed of human being. What are the 9 doors? Out of 9, 7 are welcoming doors like hearing, smell, eating, and viewing. These are the 9 doors, and 2 exit doors below the navel. One is a physical relief, and the other active through the sacral chakra to enjoy mental relief, to procreate, and to achieve ultimate target, that is spirituality. Love may not remain forever. Relationship below the navel of sexuality and spirituality is ultimate, even if they retain in the space Lord Buddha. Achieving spirituality from... Hello?
Sorry to interrupt you. Just 2 minutes left, sir.
Sir, 2-3 minutes और ज़्यादा दे देना, काम निपट जाएगा.
Yes, okay.
Just requesting. It's a very important aspect in the last few slides only. Achieving spirituality from our own culture. आप मंदिर जाते हैं, मंदिर माथा टेकते हैं तो पहले पेड़ी को हाथ लगाते हैं, तो राइट हैंड लगाते हैं। राइट हैंड लगाते हैं तो लेफ्ट ब्रेन आपका एक्टिव होता है, तो मन की बात आ जाती है। जब अंदर जाते हैं तो देखते हैं पुजारी जो है लेफ्ट हैंड से पूजा कर रहा होता है, तो राइट ब्रेन एक्टिव हो जाता है। And they both, when they are active, echo of the bell take the 7 seconds to activate 7 chakra of the body, a well-designed bell, and also produce sound of Om. So the happy hormones are released: dopamine, serotonin, oxytocin, and epinephrine. So I want to just stress that the children who are going to the our spiritual places, they are less involved in the sexuality before the proper age, because they are in a happy mood rather than going into sexuality or other wrong things. Sexuality and spirituality. Sexuality and spirituality are interwoven. Sexual energy and excitement generated in the pelvic region to raise the psychic energy up. Sexual energy traveling down through the sacral chakra, exit in the creation and phase of sexuality, and while traveling up to the crown chakra to the spirituality. It is though the chakra to the very crown of the head, it enters into the union of cosmic orgasm, which is eternally generated by sexual play. That is the Hinduism suggests. Spirituality to sexuality to spirituality, there are a right hand and left hand path. The right hand path seeks to achieve this elevation of psychic energy through the meditation and spiritual discipline rather than the actual sexual practice. That is Dakshinachar. The left hand path requires sexual expression, that is the warm mark. Although we may want to maintain the sexuality and spirituality go hand in hand, the reality of many people is that they exist in the total opposition. Faith. A set of faith, place of worship, health, loving, and self-relationship. Teen needs more than the role model. Teens need adults who are authentic, one who cares about the young people. They live in the real world, and to be comfortable here, they need evolving identity. Teen is a sacred journey from sexuality to spirituality. You are one to help them in this journey. यौन ही अध्यात्म का एक मार्ग में तृष्णा छूटे तो कृष्णा मिले. Faith. Intimacy is not just physical, it is mental, emotional, and spiritual. Connect on the deeper level if you desire a long-lasting relationship. Roadmap of spirituality. Sex and sexuality is a phase of physical intimacy for creativity. Sexuality can be activated by enjoying and passing through sex and sexuality. Sexuality is a phase of silence, non-verbal phase of togetherness. Path of spirituality is through yoga, meditation, and samarpan. Teens have a personal and inner experience of sexuality and achieve ultimate goal of spirituality. Teen spirituality is intense due to their experience to religious nature, science, and love. Teen spiritual dimension is through their humanness, emotion, intelligence, and social aspect of life in the COVID period. Job of the gatekeeper. Age-appropriate information with the basic facts about sex and sexuality. Talk less, listen more, see into their eyes. Encourage queries in appropriate time. Anticipate and be prepared. Be non-judgmental. Ask open-ended question. Use teachable moment. Be honest. Question behind a question. Imbibe value whenever it is possible. The only human being has been given the jewel of human being. What is that? That is the tongue. And in mobile, it is same. So the actual same of the human being is the tongue. You talk about the children. बातें गिरा देती हैं फासलों की दीवारें. Keep the discussion ongoing, even if it is late. Thank you so much. I am over with.
Excellent, Dr. Totia, sir. And since we are already come to short of time, we'll be taking questions at the last, big question answer. Sir, believe me, there are so many questions on my personal WhatsApp, all this from the members only.
Yes,
so if
no problem.
Permits, we will take up. Otherwise,
Yes,
we proceed to the next speaker. Chairperson, ma'am.
Thank you, Dr. Satish Agrawal. We are privileged to have our speaker for today's CME, that is Dr. Nishikant Kotwal. Dr. Nishikant Kotwal is a MD Pediatrics and DCH from Nagpur. He is certified in HRM and Symbiosis 2012-11, certified in Adolescent Health and Counseling IGNO 2014, He is a director of West Zone Member Adolescents Health Academy, representing Maharashtra, Goa, and Gujarat. He is a director of ACE Institute, Adolescent Counseling and Education Institute. He is a director of Colors Children's Hospital, Critical Neonatal Pediatric and Surgical Unit. He is also a director of Manorama Children's Hospital. Founder member, Adolescents Health Academy, Nagpur, and advisor. He is an adolescent counselor, pediatrician, and neonatologist. Over to Dr. Nishikant Kotwal, sir. Please, sir.
Okay, can I start my sharing and can you hear my voice? आपको
Yes,
मेरी
sir.
आवाज?
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
So I will start sharing and I will try my level best to share it properly. Okay. Can you all see my presentation? Hello.
Yes, sir.
Yes, sir. Yes, sir. Yes, sir.
You can see my presentation, right?
Yes, sir. Slides are
Yes, sir.
visible.
Should I put it into slideshow mode or I can change my slides? Okay. So should I start?
Definitely, sir. Yes, sir.
Yes, sir. Yes, sir.
Full screen आ रहा है अभी?
Full screen नहीं है?
नहीं अभी आ रहा है क्या? मेरे इसमें तो
No, no.
तो स्लाइड शो करा ना.
सर फुल स्क्रीन नहीं है, स्लाइड शो कर लीजिए आप।
तो वो कैसे करूँ अभी?
ये सर नीचे है, एक प्याला बना हुआ है वाइन का, उसको आप क्लिक करेंगे तो पूरा फुल दिखने लग जाएगा।
मोर में जाके
नीचे राइट साइड में,
हाँ
राइट साइड में नीचे जाएंगे
हाँ
तो वहाँ पे एक गिलास सरी का बना हुआ वाइन का, उसको क्लिक करेंगे तो सब कुछ दिखने लग जाता है।
हाँ बट अभी मैंने तो ये फुल स्क्रीन किया ना तो इसको मेरे को
नहीं सर, ये फुल स्क्रीन नहीं है सर, ये आपके सिर्फ स्लाइड्स हैं सर। राइट साइड
एकदम टॉप पे F5 दबा दीजिए सर, एकदम टॉप पे फंक्शनल की F5.
इथे मला काय फुल हे दिसून राहिलं चार्ट न्यू शेअर
F1 F2 त्यात F5 दाबा.
F1 F5
F5 5
F5 दाबूनही काही होत नाही. एक मिनिट एंड शो करून पुन्हा करू.
हा परत करा सर लॉग इन परत.
एंड शो कर दे. अभी आ गया हूं मैं. दिस इज द वन विच आई एम गेटिंग. आर यू एबल टू सी इट?
हाँ दिख तो रही है सर, पर फुल स्क्रीन नहीं है सर, दोनों तरफ दिख रहा है।
ओके
बाजूला थंबनेल पण दिसत आहे. टुटेजने सांगितल्याप्रमाणे करून बघा सर.
जी सर,
स्लाइड शो हे दिसत आहे सर.
यहाँ स्लाइड शो नहीं आ रहा मेरे इसमें, क्योंकि ये जो ऊपर का बार है ना वो वही ऊपर आ गया है. तो आई थिंक देयर बार. ओके नाउ आई विल बी एबल टू डू इट इन अ स्लाइड
शो करो। यस करो सर, रिज्यूम स्लाइड शो। हाँ
ओके अभी आ गया.
दबाओ।
नाउ यू आर गेटिंग इट.
Yes, sir. This is coming, but
स्लाइड नहीं दिख रही है, बड़ा तो हो गया,
not showing on.
बॅक करून बघा सर.
बैक पे जाओ सर,
स्लाइड मूव करा वरती.
हो तो वरती मी आता स्लाइड शो मध्ये गेलो होतो.
परत क्लिक करा, परत ते रिझ्यूम करा सर. हा स्लाइड शो क्लिक करा. क्लिक करा सर.
हाँ स्लाइड शो क्लिक किया, फ्रॉम द बिगिनिंग लिया. नाउ आ रहा है?
नहीं आ रहा।
एक साइड खाली करून बघा सर.
दूसरी स्लाइड पे लो सर।
हाँ दूसरी पे लिया ना, तीसरी पे लिया.
हाँ अब इसको करो वापिस।
सर रिज्यूम स्लाइड शो पर क्लिक करा.
हाँ इससे यहाँ से करो सर। करंट स्लाइड पे लो सर, करंट स्लाइड।
ये लेने के बाद भी यूज इज प्लास्ट। अच्छा, मैं स्टॉप शेयर करके फिर से लेता हूँ, डोंट वरी, नहीं तो फिर तुरंत अपन वी विल गो टू दी
परत करा सर, फुल सुरू.
याच्यात मी आलेलो आहे.
आलं.
You are-
हाँ,
सर,
ये-
आलाय सर.
क्या गजब करा सर आपने, मजा कर
आलं सर आलं.
आलंय.
सर आलाय.
हो सर आलाय.
पण आल्यानंतर मला चेंज नाही होऊन राहिला, तर ते दॅट इज द प्रॉब्लेम. रिमोट कंट्रोल दिया है क्या?
प्रकाश शेअर कोण करतोय?
ओके, आता अर्थ आहे. कॅन यू सी?
हो सर, हो सर.
Okay, okay. So should I start my lecture and you are able to hear my voice properly?
येस सर.
Okay. Everybody can hear because I can't hear.
Yes, sir.
everybody.
Yes, sir.
Okay. After hearing Dr. Tuteja's talk, I think I should not have taken a lecture. I think Satish, what you tried to do is,
सर मेरे मजे क्यों ले रहे हो आप?
क्या करूं यार, आखिर आपसे ही तो शुरुआत करना पड़ता है. आई एम रियली थैंकफुल टू डॉक्टर नरेश तायडे, डॉक्टर सुशील राजपूत, डॉक्टर ऋतुराज देशमुख, and my friend Satish Agarwal. Why I say that it is very difficult to take a lecture after Dr. Tuteja's lecture, because there are two interesting words which are coming in Dr. Tuteja's lecture, and they are very important in last 2 years, more important. One is sex, and other he was talking about sexuality. So in COVID era, people have started going away from sex to sexuality. I think Dr. Tuteja would definitely agree with me, because one of the thing was not available at all. Am I right, sir?
Sir, everything was available. It depends on the choice.
But the lockdown had locked it down.
How afraid you are, or how courageous you are.
Yeah, and I was really wondering your comment that ultimately we needed Dr. PM Modi, who is now a brahmachari, to talk and say that yes, sex education is very essential.
इसीलिए सर मैं उनको ले आया फोटो पिक्चर लेके.
So my topic is all related to the last 2 years which we have gone through, and the story all started in February 2022, and the March 2022, when the first lockdown started. We are still having partial lockdowns or partial restrictions, and I would like to tell you how different types of personality have adopted to this COVID. Because COVID shows us the strength to adopt or a failure to adopt. There are 5 broad traits which make up for basic personality traits, which are: one is openness. As you know, myself and Satish, we are open to talk to each other, so that openness gives us more power to deal with things. Conscientiousness about things. Extroversion, whether we are able to express. Agreeableness, dealing with lockdown and agree to the norms which the government has put it. Neuroticism is more moodiness, react more to the stressors, and this 5th is the most important factor in dealing with the lockdown and the last 2 years. So personality, how a personality and well-being is connected. Personality trait can play a greater role in mental health, in people's ability to cope with stressful events. See, if you are open-minded, you are able to express whatever comes down in your mind, you get less and less stress. But at the same time, if you go on talking about anything which comes in your mind, you create stress for others, and then you create stress for yourself, because then you regret what you have talked about. So extroversion is good and bad when we use it in a proper context. One study shows that the personality of agreeableness that openness, conscientiousness, and extroversion, and a low on moody, that is neuroticism, are the best which were suited to deal with our COVID situation of the last 2 years. So what is extrovert personality? These personalities, they thrive in social situations and gain एनर्जी फ्रॉम अदर्स. सो हम देखते हैं कि जब हम कॉन्फ्रेंस में जाते हैं तो एक्सट्रोवर्ट लोग सब लोगों की खिल्ली उड़ाते हैं, खुद की भी खिल्ली उड़ाती है, बट दे गेन एनर्जी फ्रॉम अदर्स. सो फॉर देम, फॉर an extrovert person, social situations were very important, and that is why these extroverts were least likely to comply with the shelter in place orders during pandemic. उनके लिए ये पैंडेमिक का लॉकडाउन यानी उनका एनर्जी ड्रेन करना का समय था. एक्सट्रोवर्शन इज टिपिकली लिंक्ड टू बेटर कोपिंग स्किल्स इन जनरल. सो व्हेन एवरीथिंग इज नॉर्मल, extrovert people are typically better equipped to deal with social environment. Whenever they are going to school, they are better equipped. When they are going for the conference, they are better equipped. Whenever they are going to take a decision of marriage or career, they are better equipped. So people with this personality have very high levels of resilience and less stress, because the life has always stress, remember, and how you deal with stress gives you less stress, and that is your ability of resilience. Introvert personalities tend to feel drained by social interaction. They don't like to mix with each other. Usually you see them alone in the corner. Introverts had an easier time coping with social distancing and working from home, because they are not trained now. For some introverts, the year of pandemic was the time for personal exploration and really of freedom, because they wanted freedom from social interaction. Ambivalent personalities are having both the traits of extrovert and introvert. These people enjoy being alone, but at the same time, they are not adverse to social interaction. They deal better with aspects of quarantine than many other introverts, because they did not grumble about lockdowns and other things. So what was the life which was present during COVID? It was really a challenging time. You had lockdowns, you had no socialization, your personal movement was restricted. The adolescents could not meet each other. The adolescents in relationship or friendship could not see the physical form of their friend. There were no festivities, there were no marriages, no conferences. So the stress busters were totally missing from our life. No virtual meetings were there, no schools. So learning was the most difficult thing, because online learning is not so easy at the age in which the adolescents are. Online learning is better when you are already grown up and you become adult. Restricted physical and mental space was there. Loss of life in life. Our whole life had no life in it. And there were really a loss of life, because there were so many deaths in the families during COVID days, and we had a lot of dependence on digital world. We are all talking about media literacy, media time, media rationing, everything. And now look at last 2 years, we were totally dependent on digital world. So changing life after pandemic. Imagine now what would be your life, or a life of an adolescent. I would come down to the main theme of topic, that what is happening to the girls. So changing after pandemic would be going back to school, going back to work, dining out, going to movie, visiting friends, families, and festivities. You all must be thinking, this is lovely, isn't it? Now I will be able to go back to school. I'll be able to mix with my friends. I will dine out. I will have a good movies which are coming up because that there was a shortage. Visiting friends and families and festivities. But is it so? No. Because not necessarily all this opening is going to be taken up very well by the human brain. Because last so many years have created a sense of anxiety in us. Fear of becoming ill would be there. There would be so many people who are not following the normal norms. And so worry of that complacency would be there. So you will feel that whether I would fall sick, those families who have lost somebody during COVID, they would be getting more worried about it. Anxiety about getting reaccustomed to the society. The society which we were facing was most law-abiding society in the world these days. But now what is going to happen? You are going to face the rowdiness of the society also. So you will be worrying about losing positive changes which are coming up after the lockdown is over. So you will have a redesigned world, transformation from safe study in the house, safe workplace to open place, safety worries, reconnecting with people. Sometimes you never wanted to reconnect because there was a lot of bullyism which does occur when children go to school. And so reconnecting with people creates now more of an anxiety. Stress of balancing health, the economics, which has suffered badly. So balancing health, economics, social, family events is the most difficult thing because you had a reason these days to curtail your expenditures during COVID days. Now you have no reason, and mental health issues. So what could be the spatial challenges for girls? You will be wondering, still in this world, education of the girl may be stopped. And why they would be stopping it? Because all over girls are earning, they are becoming more, they are more confident. But when the finance gets affected, what gets affected first is education. And girls' education still in smaller villages is a most difficult thing to give. Financial crisis affecting employment. Many of the girls, though it is not allowed for boys also, but they were doing some work or the other. They were earning. That employment was affected. That has led to financial crisis. So what all these financial crises and education would lead to? More of physical abuse, more of sexual assaults. There were girls who were getting abused when they were in the house. The abusers had a greater chance of abuse. And since they are greater chance of abuse, these girls have now a mental health issues. Career degradation when they are girls, means grown-up girls, because lack of more chances. So again, gender bias will come into picture. Trafficking has definitely would increase. Any financial fall leads to three things: child trafficking, sexual abuse, and gender bias.
Sorry to interrupt you, sir.
Yes.
2 minutes left only.
Yeah, I will be complete because this is the last slide.
Yes, sir.
Yeah.
Yes, sir. Thank you.
Migration. The migration which has occurred that has to be adjusted because during COVID situation it was easy to adjust in a very safe environment which was previously there. So all these things are going to give to neglect on a personal hygiene, personal health, and anemia. And as the previous speaker has said, these are the areas in India where girls suffer more, is in personal hygiene, health, and anemia. So What are the mantras to deal? Taking care of your own safety, your own diet, your own health and relaxation. Find your own time now. Sharpen resilience and coping skills. Talking to people will give social support, especially to girls if they talk about any harassment, whether it is financial, whether they need us financial help or they are getting sexually abused. Focus on present moment, that is mindfulness. Go slow, select focus, and optimize energy. Thank you, friends, and let's meet again. Bye. This is Dr. Nishikant Kotwal. Thank you very much.
Thank you very much, sir. It was a very interesting and thought-provoking your lecture. Thank you once again. Over to Rishikesh.
Thanks, Dr. Tuteja sir, Dr. Agrawal sir, and Dr. Nishikant Kotwal sir for a wonderful lecture and great knowledge shared by you, and it will be helpful for all of us. And I will complete my part and hand over my responsibilities to Dr. Abhijit Morwal, and who will be heading and managing the next 2 or 3 sessions of this CME. Thanks. Abhijit Morwal sir, heading to you.
Thank you, Rishikesh.
Thanks, Dr. Rishikesh. Because Abhijit will be introducing everybody, so it becomes my duty to introduce Abhijit. And thank you all the chairpersons and the speakers of the previous session. Now we are at the halfway mark. And for the next half, we are having Dr. Abhijit Morwal as the session in charge. And as the slide showing, he has done his undergraduate and postgraduate from Institutes of GMC Nagpur and State GSMC in King Hospital, Mumbai. At present, he is a consultant at Hospital Amravati and ex-consultant at District Hospital Amravati. In charge medical superintendent at Rural Hospital, Hatpuri. A very extreme, gentle and soft-spoken personality apart from a good academician. Welcome, Dr. Abhijit Morwal, and take over the session.
Thank you very much, sir. I am thankful to the organizers and IIP Amravati family for giving me this chance. Thank you, our President, Dr. Naresh Tayade, sir, Secretary, Dr. Sushil Rajput, sir, our Treasurer, Dr. Rishikesh, Dr. Ruturaj Deshmukh, sir. I welcome the chief guest for today's CME, Dr. Uday Bodankar, sir, and Dr. Renu Boralkar, ma'am. I also welcome all the panelists, chairpersons, and speakers for today's CME. I am also thankful for all the viewers attending this CME. For starting next session, I welcome Dr. Jyoti Agrawal, ma'am. She is a senior pediatrician and is a consultant at Agrawal Children's Hospital, Amravati. Over to you, ma'am.
Yes. I'm audible?
Yes, ma'am.
Yeah, madam. Yeah.
Okay. Good afternoon, dignitaries. It's lunchtime, and what a better time to talk about nutrition, and that too maternal nutrition. And the speaker being none other than the person who is associated from day one with infant and child nutrition. I take pride in introducing our very own Dr. Satish Tiwari, sir, who has put IIP Amravati on national and international level. He's a pediatrician with an LLB. That's why founder president of our Medical Legal Ethics Association, always on our side in our troubled times. Founder convener of Human Milk Banking Association, professor of pediatrics at Amravati Medical College. He's president-elect of IYCF chapter 22-23. He has, to his credits, many prestigious orations like Dr. Nirmala Kesari oration, Dr. Shirole oration, Dr. Ghoshal oration, and he has been awarded Dr. N.B. Kumta Award. He is editor to Textbook of Medical Legal Issues, Textbook of Maternal, Infant, Young Child, Adolescent Nutrition. Friends, these are only few feathers in his cap. I request Dr. Tiwari sir for his lecture on significance on maternal nutrition. Dr. Tiwari sir, please.
Okay, please allow me to share the screen.
Sir, please share your screen.
Yes. Is it visible?
Yes, sir,
Yes, sir.
but not full screen.
Now it is full screen.
Yes, yes, sir.
Okay, thank you, Dr. Jyoti Agrawal, madam, and thank you, organizers, IIP Amravati, for giving opportunity to speak on a very important topic of maternal nutrition. And basically, we'll be discussing the basics and essentials of maternal nutrition. As we all know, the roti, kapda, and makan. And now to this, we have added health and spirituality are the basic needs of each and every individual on this earth. When we talk of nutrition or food, we have to discuss about the carbohydrate or energy, protein, which includes the various types of protein, that is reference protein, net protein utilization, limiting amino acid, etc. Then fat, of course, visible and invisible fat, omega-3 and 6 fatty acids, high density lipoprotein, low density lipoprotein, saturated, unsaturated fat, everything. And then, of course, we have minerals, vitamins, macronutrients and micronutrients, fibers, and of course, water is equally important. Now, when we talk about all this, what we forget or what we fail to understand is what is a complete food and what is a balanced food. Now, complete food means a food which contains almost all the things what we discussed in the previous slide. That means carbohydrate, fat, protein, minerals, vitamins, water, everything. But a balanced food means the food which contains all these in a balanced form or in a balanced amount. So for all practical purposes, milk is a complete food, but unfortunately, we do not have any food that can be labeled as a balanced food. So we have to make a balanced food rather than having a naturally balanced food. As far as maternal requirements are concerned, the caloric requirement, as we know, depend on the work or the day-to-day activities of the mother or the individual. Plus, during pregnancy, we required 300 calories per day extra, especially in the second and third trimester. And during lactation, it is 700 calories extra as compared to the basic requirement. As far as protein is concerned, 1 gram per kg per day is basic requirement, plus 5 gram extra in the second trimester and 10 gram extra in the third trimester. Fluid, nothing is mentioned about the amount, but it is everywhere said that there should be adequate hydration. And if the hydration is less or fluid intake is less, the amniotic fluid may be less and all the complications of oligohydramnios can occur. Micronutrients like iron deficiency will result into anemia, calcium will result into improper bones, iodine, we all know, is required for the thyroid functioning, zinc is for the growth and the skin, etc. Vitamins, we know the importance of folic acid in maternal nutrition, otherwise the chances of neurological or anatomical defect in the neurological system. And as far as overall nutrition is concerned, the weight gain in pregnancy should be around 11 to 12 kgs. That is for an average Indian mother. So if you look at this photograph, the most of our food should be grains, then of course vegetables and fruits, milk and other milk products, of course then non-vegetarian, and fat, salt and sugar. Now when we talk of nutrition, please remember mother and baby should be considered as a diet. They should not be separated. because the maternal nutrition will always affect the fetal nutrition. Nowadays, many of our members or in many societies, there are Garbh Sanskar civils or the Garbh Sanskar programs, which we all know that according to Hindu mythology, many things what the fetus is exposed during the antenatal life, he learns many things in mother's womb, which includes learning about the nutrition. So maternal nutrition has a very high impact on the fetal and child nutrition. And if you do not take proper care, then the chances of LBW, IUGR, preterm are more. Then according to the latest developments, we were talking about the evidence-based medicine. And the evidence-based medicine at present shows that most of the diseases, they are related to the genetics. In nutrition also, we have what is called as epigenetic state, which means alteration of gene expression and fetal genome related to nutrition. So the nutrition problem is there, it will result into a defective fetal programming and the genomic imprinting. We'll discuss this in next slide, that nutrition can alter the fetal programming and genome imprinting, which will result into permanent damage and lifelong vulnerability if not taken care of. Maternal BMI, maternal weight less than 40 kg and maternal height less than 145 centimeters. They are all associated with neonatal size, and all this can affect the birth weight, the intrauterine growth retardation, and as we discussed, preterm, fetal morbidity and mortality. And of course, if the child survives, the various non-communicable diseases like heart disease, diabetes, obesity, etc. in the future life. This is based on the what is Barker's hypothesis or the Ford hypothesis, that is fetal origin of adulthood diseases. So according to the latest evidence-based medicine, most of the adulthood diseases have origin during their fetal life. So undernutrition in fetal life or early infancy, what happens if the baby is not getting adequate nutrition? There is adoption where the prioritization of brain growth is taken care of. So rest of the body does not get nutrition at the cost of nutrition for the brain. This results in various hormonal imbalances like reduced secretion and sensitivity to fetal growth hormone, insulin, and insulin-like growth promoting factors, IGF-1. And as we discussed, epigenetics, this becomes permanent or programmed in utero, and then in response to the adverse environment because of the less nutrition. So all this is programmed in the baby's genes or the genetics, and it gets imprinted in the baby's gene. So according to Barker, all this will result into small baby syndrome, that is LBW or IUGR. And as we know in marasmus, if there is a lack of nutrition, then once the baby gets nutrition, there is a compensatory catch-up growth. So this also occurs in the intrauterine malnutrition, and there is a catch-up postnatal growth. So this results into then excessive assimilation of carbohydrate, fat, and protein, resulting into obesity and obesity-related non-communicable diseases. So according to this hypothesis, our genes are probably incompatible with modern living, where the consumption of calories is more in form of junk food, and expenditure of calories are less because we have now the more of the physical comforts in the life rather than the burning of the extra calories which we consume. So this results into the obesity and all subsequent problems. So that's why we say that the recommendations for nutrition are now important for the first 1,000 days of life, which includes 270 days of pregnancy or the antenatal period. So the maternal nutrition during ANC and of course during lactation are very important. So the preparation for proper maternal nutrition should start during antenatal period. Motivate the mothers regarding the nutrition, especially those who are undecided what to eat and what not to eat. We have to build the confidence of mother. It is very important. The more we are talking of the World Women's Day and International Women's Day, but as we are celebrating this for last so many years, what I have found, the year after year, the confidence of mother and the confidence of doctor in the mother is going on decreasing. So this is really unfortunate. More the mother is educated or informed, she has less confidence in her own abilities as far as the nutrition is concerned. So we have to inform best practices for the nutrition of the mother and baby. And of course, we have to convince that if there is some problem, we are there to help her out if there is a problem. This is the classification of various food groups by WHO, that is known as now dietary diversity. We will not go into detail, but we can see that the food diversity has been divided into 7 groups by the WHO. So this is not for Indian mother, this is for all over the world. There are grains, roots and tubers, then legumes and nuts, vitamins, other fruits and vegetables, dairy products, eggs, and the non-vegetarian food. So there has to have a balance. As we said, the balanced diet or the balanced nutrition has to be there. And all these groups have to be consumed, at least 4 to 5 groups at a time, to have a balanced food. So what to give to the mother? Please prefer the homemade, easily available, cost effective, less spicy because there is no advantage of any spices. Caloric dense, for that we can add sugar, ghee or oil. What is important, what we forget when we say of maternal nutrition or child nutrition, that basic requirement of any individual is a cereal and a pulse. And if he eats or she eats cereal and pulse, then only there is a requirement of fruits or vegetables. So no one can have all the nutritional requirement only with fruits and vegetables. The basic requirement is a cereal and pulse. What should be avoided is only milk. Avoid the caloric gap and avoid the commercial foods because they are costly. They contain preservatives. They are not fresh. And many times they are artificial. As far as milk and dairy products is concerned, avoid only milk because though it is a complete food, it is not a balanced food. Prefer curd, paneer, cheese, butter, ghee, etc. The buttermilk and lassi are more acceptable as compared to milk. It can also be used. That means the buttermilk and lassi can also be used in diarrhea and lactose intolerance where the milk cannot be used. There is advantage of lactobacillus with the use of curd and the buttermilk. And of course, the paneer and butter will contain protein and fats. Ghee contains fat. And the dairy products are important source of vitamin B12, especially for the vegetarian people. So only milk is not recommended. What is recommended is give milk-based cereal food or the diet. Now, very important to understand there is no advantage of so-called protein powders or commercial supplement. But unfortunately, again, the protein powders are misused enormously. Other disadvantages of milk, it can result into cow's milk allergy. There are many diseases which can pass through milk. And we all know nowadays oxytocin injections are given and there are many chemical pollutants in the milk. So what is required, you can see in the photograph, the kheer or milk-based diet should be given. If you are not convinced about the protein powders, these are some of the photographs. You can see personalities like Sania Mirza, Amitabh Bachchan promoting the artificial protein. The Pediasure complain, the claim that they are #1 brand prescribed by the pediatrician. So IP has taken objection on this, but nothing is happening. And as we were discussing, the protein powder ना कभी सरकार ने जांचा ना देश में कोई medical research मौजूद. This is 2015 cutting from the newspaper, and the things have not changed in last 7 to 8 years. What is the concept of restricted diet and free diet? So salt restricted, we all know if there is a hypertension, pregnancy-induced hypertension or renal disorder. Caloric restricted diet if there is obesity or diabetes. Fat restricted diet again if there is obesity, diabetes or fat malabsorption. But remember, the concept of free diet is not there. So there is no salt-free diet or caloric-free diet or fat-free diet. It has to be restricted diet. Free diet is only required if there is a proved cow's milk allergy or lactose intolerance, or if there is a gluten-induced GIT problem, then gluten-free diet. Role of fat, we all know it increases palatability and satiety. It's important for the growth of brain, nervous system, vision, and cognitive function, especially the long chain polyunsaturated fat, omega-3 contents, the DHA content, and of course in cholesterol, we know the high density lipoprotein is important, but fat should be restricted as we discussed in obese, diabetic, or patients with heart disease. Very important misconception again, as we discussed, that fruit and vegetables are good, they are must, but not at the cost of calories and protein. So first, cereal and pulses. Then of course, the fruits and vegetables, which are good sources of minerals and vitamin. More than 30 to 40 fruits and vegetables may be available in market. All are not must, remember. So it's not must that every mother or every child eats each and every vegetable or each and every fruit. Any 3 or 4 fruits or the vegetable may be sufficient. As we discussed again and again, it has to be after cereal and pulse. Prefer the fruit or vegetable which has more pulp and calories. And very important, prefer the food and vegetable which are seasonal because they will be the cheapest available in that season. So which fruit or vegetable should be used is the cheapest available fruit or vegetable. So prefer whole fruit or vegetable and avoid juices and soups. Because the juices and soup, they decrease the calories. The pulp and fibers are lost. They become costly and need extra effort in preparation. So for juice, you will require someone to make the fruit juice, and soup also extra effort is required. Again, there may be many misconceptions like whether to eat vegetarian diet or non-veg is more important. So in non-veg, the animal protein is there, which is supposed to be a better source for protein. And of course, vitamin B12 and other vitamins may be more in non-veg. But at the same time, there is chances of allergy to the animal protein, chances of disease transmission if the animal is suffering from some disease. So non-vegetarian is not mandatory. Vegetarians can get adequate amount of a balanced food or nutrition by following various combinations. Very important, the concept of hot and cold. According to this concept, hot food causes diarrhea and indigestion. The examples are there. Cold food causes cough, cold, tonsillitis, and pneumonia. But please remember, there is no scientific explanation for this in modern medicines. Of course, sometimes there can be allergy to any food. It can be hot or cold, or it can be any food. Nutrition education of the family is important, which many of us are lacking. Other myths and misconceptions like rice results into obesity, and if some operative procedure like LSAS is done, then it is going to result in stitch infection and abscess formation. Brinjal and groundnut can cause allergic rash. Spicy food causes loose stools in baby. Cold water or more water will cause distension of abdomen. And Bengal gram or chana dal will again result into indigestion and stitch infection. But scientifically, all these are myths and misconceptions. If you want to know what type of food it is appropriate, acceptable or avoidable, we can follow this classification. Appropriate food are cereal, pulses, we already discussed, the mashed potato, sweet potato, milk-based cereal food. Acceptable food are the home available like bread, cake, pastry, biscuit, ice cream, etc. But we all know that most of the nutritionists do not advocate this for the obvious reason, because most of them are artificial and commercial. And of course, the avoidable food we all know are the junk food, artificial food, fast food, and the food which are repeatedly fried because it contains trans fatty acids. The processed and refined food has chemical contaminant and nutrients are lost. Like if you process the brown rice and make it white, many nutrient contents are lost. More processed or refined the food is, chances of deficiency or diseases are more. The contamination with fertilizers and pesticide, and that's why the concept of organic farming is coming. And the processing or refined food is different from fortification. In fortification, we add iodine or iron to the salt. So the artificial or processed refined food are basically most of the times are the junk food, which are known to be unhealthy to consume, and food that has been processed to the extreme. It lacks fibers, vitamins. There is increased risk of cardiovascular disease, obesity, diabetes, and non-communicable disease. It promotes the Western lifestyle and the lifestyle which is junk food filled world. But unfortunately, many of us are not understanding this. And if we are understanding, then we are unfortunately not following this. And this is in spite of the human rights. And we all know that there are many fundamental human rights, which include promote respect of this right and freedom. And this right includes adequate health and well-being. Motherhood and childhood are entitled for special care and assistance. So it is important in the present era when we are talking of women empowerment, there should be proper nutrition because it is the mother's right and child's birthright. We'll not discuss this IMS Act here, but the IMS Act applies to the maternal nutrition also. And one of the provision, the last line on this slide is company representative cannot educate mother about the mother's nutrition or the child's nutrition. So this is how the IMS Act is applicable to maternal nutrition. Not going to detail.
Sir.
Yes.
Your last two remaining, Arun. Last 2 minutes.
Yes. So we'll not go into the details of IMS Act, but we have to keep in mind that it is applicable. Then of course there is Food Safety and Standards Act. So finally, before we come, what to do? We have to have a nutritional education, that is timely supplementation. We have to educate mother what to eat, when to eat, how much to eat. Assessment and early diagnosis of deficiency like iron deficiency, so anemia prevention and treatment, iodine deficiency, so taking care of thyroid. We have to see that balanced diet. And in the morning, we had a whole lecture on the government programs and nutritional programs. You can see the photograph of this book. We are coming out with this book in this month only, Essentials of Maternal, Infant, Young Child and Adolescent Nutrition. So from next month, this book will be available. Before we stop, the last 2 or 3 slides, where we have failed. So did we achieve what we wanted in last 15 to 20 years or even 25 years? Unfortunately, we have not achieved what we wanted. Is it because of lack of knowledge? Answer is no, because all of us have knowledge. But what is happening? We are having misguided information on media, lack of time and overbusy schedule of so-called practitioners, whether we are a pediatrician, obstetrician, or community health worker. Many times there is act of omission on our part. We are not ready to take out old myths and misconceptions from the mind of mothers and relatives. Of course, there may be some non-responsive mothers and relatives, but ultimately we feel that it is lack of commitment on the part of the physicians or doctors. So time has come where we have to join hands, all of us, not only pediatrician and obstetrician, but as we said, community health workers, other health workers, government or private. So we have to have some important carry-home messages. We should avoid adolescent or early age pregnancy, remove misconceptions and false belief, promote nature and dump the junk. Commercial supplements has no advantage over natural food, while rather they have the more disadvantage. So do not get misled by unscientific promotions or advertisements. We have to become an empowered and informed consumers. We are talking of women empowerment. So all our mothers must be empowered and informed. Mobilize the social support. Nutrition education and counseling is important. And the golden rule for any society or community is we need lifestyle modification. So this is all we are doing through IYCF chapter, the Human Milk Banking, the Indian Academy of Pediatrics. And finally, our work has been appreciated by many organizations and many orations and awards have been given for the work on maternal and child nutrition. I thank the organizers for giving this opportunity, and I thank again the IP Amravati for this occasion. Thank you. Thank you.
Thank you, sir. Thank you so much for such an excellent talk. And yes, if maternal nutrition is good, we will have a cycle of a good child nutrition also, because the food fads in mother's mind will be removed, and this cycle will definitely help us in long run. Thank you, sir. Should we move to the second topic, or are there any questions? I think we move to the second topic. Thank you, sir. So our second topic in this session is how to make a girl confident. And for this, we have our own confident young obstetrician and gynecologist, Dr. Rashmi Nagalkar, who has been practicing at Amravati since last 13 years. She has been past president of Inner Wheel Club and JCI Amravati Golden. She is provisional trainer, zone trainer of JCI India. She is certified assessor for Manyata program of FOXY and assessor for Balridge Healthcare program of Confederation of Indian Industries. She is an active member of Rotary Club and OBGY Society. Welcome, Rashmi, and please start with your deliberation.
Thank you, ma'am. Thank you for kind introduction. At the outset, I must thank the organizing committee, IIP Amravati branch, and special thanks to Dr. Satish Tiwari sir, who allowed me to interact with all of you. Please, can you share the slides?
Prakash ji.
Yes, ma'am. Just a second. Ma'am.
Yes, thank you. So my topic for today's discussion is how to make a girl confident. Can you please move to next slide? Yes. So before starting the topic, it is a study carried out in USA, which states that up to the age of 8 years, the boys and girls both are equally confident. But as the girls approaches her 18, yes, as the girl grows and between the age of 8 to 14 years, the confidence level of girls drops by 30%. So why it is happening so? As the girl approaches adolescence, the openness to risk and failures become buried. And to add to this, parents become more proactive. They don't allow their girl child to stay long hours at night outside the home. They put restrictions, and also the society put restrictions on girls. And that's why their confidence level goes down. More to add to this, girls' brains have estrogenic effect, which heightens the emotional intelligence and curbs risk-taking behavior. Girls have a more active prefrontal cortex, and so they see the consequences and worry more about them. So they don't want to take extra risk. And this is the factor which reduces their confidence level. As compared to boys, boys take risk, they fail easily, but girls don't. Next slide, please. Next slide. So, as we all know, the social media also has a most distressing effect on these girls. As you know, the coin has two sides, brighter side and the darker side. The brighter side of social media is that we can connect to anyone, we can virtually expose our interest to the whole world. But many girls take the black side of this social media. They constantly compare themselves with the photoshopped, airbrushed images of the perfection. Many of the girls put their selfies taken on the Insta or Facebook and think that this my friend will like it, and they count the likes, the comments, and they go on overthinking. And if they don't get the comments or likes, they get depressed and start losing their confidence. They misinterpret this ideal female beauty. Actually, what is the female beauty? It lies in helping nature, in creating a good social environment around us, in helping others to grow with their morals. It is the inner beauty. But these young girls don't understand this depth of beauty. So they engage in unhealthy practices to achieve the ideal female beauty according to them. What are the unhealthy practices? They start eating less, they do gym very vigorously, and they want their body shape to keep in proportion. But basing self-worth on these superficial things or external circumstances or other people leads to lack of confidence in long run. Next slide, please. And parents and friends play an important role in bringing these girls to their confident level. If the parents are unsupportive, means they want to uplift their children as their wants are or as their wishes are, and these are unrealistic expectations from the parents for their girl child. They want, each of the parent want that their girl child should be academically excellent, but it is not so in each and every individual, because every child, every person is a unique person, and if the expectations of the parents are not met, they constantly go on criticizing, pressurizing their kids. And that's why these kids lost their confidence. Moreover, if the friends are from bad community or they have bad like addictions, if they are indulged in sexual activities, and if they are making fun and putting her down, and this unhealthy competition is there between the friends and these girl childs, then these girls will lose their confidence day by day. Next, please. So friends, these girls are under tremendous pressure of building their image, achieving something in the life. And you and me, we doctors, parents, all the guide, supporters are there to encourage them to build their confidence. First and the foremost thing, most important thing is they have to accept themselves as they are. Tell them that you are a unique person, you have unique qualities. You try to love yourself as you are. No need to change because others are doing that. I should also do that. This is not the way of life. You should literate them for media literacy. Means you as a parent should look what they are looking in media and tell them that this is a superficial world. This is not a real world. If you are getting likes, it doesn't mean that the other people who is sending likes is really liking you or appreciating you. It is just a give and take relationship. You are liking their post, so they are liking your post, and so on. So build their inner values. Tell them that this is a superficial world and don't indulge in this media. Encourage sports as early as possible because sportsman spirit is the thing which they will develop in the early ages. Suppose at the age of 6-7 years, you put your kids in sports, they will know the importance of team building, values, and they will scientifically, it is proved that those kids who are in sports, they secrete endorphins, which are good hormones, and they build a self-confidence. So, and encourage your kid as early as possible in sports. Praise their efforts, not the outcome. Many times kids will fail, girl will fail, but she must have taken as much efforts as she can for this match or for the exams. So you have to praise the efforts she taken so that in the next match or in the next exam, she will not get her moral down. She know that our parents like me as I am. It is not the outcome which they want. It's the efforts which they want. So she will do her efforts as good as she can. Discover her strengths and weaknesses. As we have already discussed, every child is unique. So some child may be good in arts, some may be good in music, some may be strong in sports. And if you divert them towards studies, then they will not be able to make the best out of them. So try to find out her strengths and weaknesses, encourage whatever strength she have, and try to cut down the weaknesses or shorten the weaknesses she have. Next slide, please. Be assertive, not aggressive. Many times we see that parents or teachers or supporters, they are outcome focused, means they want the best outcome to come from the girl child or from the kids. And if she doesn't receive it, then we get aggressive. But we have to be supportive, empathetic to the girl, encourage her for doing the things. And failure is the part of this journey. Though she fails, don't be aggressive. Calm her down. First of all, calm yourself down and encourage her. Encourage for new opportunities. Now the world is full of many opportunities. Don't stick your old pattern of curriculum with you. Let them try new opportunities. They will fail, then learn, and then grow. Be her role model. For me, I think it's a most important thing we can do for the kids. Actually, if we tell the kids to change such and such pattern, they will not listen. They will observe you minutely and they will follow you. So whatever change you want to bring in your child, you have to bring that change first in yourself. And you as a parent or as a teacher are role model for them. They will follow you. You need not have to say anything. They will typically observe and follow you. You have to emphasize your values. As our Dr. Tuteja sir and other speakers have rightly said, value-based education is the need of the hour. You have to emphasize values in your kids, and they are carried in them unknowingly from your behavior. You have to balance freedom and guidance. If a parent or a teacher do micro observation of your kid, and every time you want to guide them, you don't give them freedom, then they will lose confidence. They will think that I am not doing anything properly. I am not able to take any decision. So you have to give them freedom, but you have to balance it. You have to guide them whenever you think that they are going on the wrong path. Likewise, you have to develop positive self-talk. This is also one of the key thing you can give to your kids. If you tell them that it's okay, you fail, but you have to again try and you can success. You can get success. Then the positive self-talk in their mind will start. And this habit is the must in these days. Next slide, please. So self-confidence is superpower. Once you start to believe in yourself, magic starts happening. So kids, girls, start believing in yourself. You can conquer the world. All the best. Thank you. Thank you very much.
Thank you so much, Dr. Rashmi. It was very nice deliberation and very powerful slides and very powerful advice you have given. Yes, we can do it. And I think we are the best examples and we are the best role models for our children. Yes, you have definitely given a very good deliberation. Thank you so much. Over to Dr. Abhijit.
Thank you very much, ma'am. Thank you for chairing this session. I also thank Dr. Satish Tiwari, sir, and Dr. Rashmi Nagalkar, ma'am, for sharing their knowledge and having such a wonderful session. For starting our next session, I welcome Dr. Meenal Deshmukh, ma'am. Ma'am is a president of OBGY Society Amravati. She was a joint secretary at AMOGS 2020. Ma'am is a co-director at High-Tech Critical Care and Dreams Hospital Amravati. She is a member of IAEC FOXY committee. She is also a zonal trainer of ICI, JCI India, and a trainer of Dhira VAW program. She has done a group study exchange program to Sweden through Rotary. Ma'am is currently working on high risk obstetric and on menopause with program of Fabulous Over 40. Over to you, ma'am.
Thank you, Dr. Abhijit. Good afternoon to all stalwarts of life. Indeed, a unique situation. I thank the organizers for inviting me to chair the session, and I congratulate the organizers running the CME on time. So, to begin with, I call up my dear friend, partner, on neglected aspects like adolescence. Dr. Suyog Panar is a consultant gynecologist and practicing in Amravati since 12 years. He has received a Tripti Haranikar Award for standing at University and late Srimati Shailaja is past secretary of Amravati, past treasurer of Prism Conference, member of Ethics Medical Legal Committee 20, worked in PCPNDT cell years, member PCPNDT Advisory Committee Amravati, heard many talks and presented at various conferences, and she has special interest in Bachao. What do you?
Am I audible? Am I audible?
Yes, Yoga.
Yes, ma'am. Yes, ma'am.
Thank you, Meenal, for that wonderful introduction. And I am privileged that you are a chairperson for my session. At the outset, I would like to thank Dr. Satish Agrawal, sir, for this wonderful opportunity and giving me this brilliant yet sensitive topic of neglected aspects of psychosocial issues of an adolescent girl. May I request Prakash to please share the screen? Yeah. To begin with, I would like to begin my talk with a nice poem on adolescence. Adolescence को किशोरावस्था भी बोलते हैं और एक छोटी सी कविता इसके बारे में। नए नए रंग अच्छे लग रहे हैं, यही किशोरावस्था का दौर है। शुरुआत एक नई उम्र की, सब अलग अलग लग रहा है, यही किशोरावस्था का दौर है जिसमें संभल कर चलना है। नए नए दोस्त बनेंगे, थोड़ा सावधान रहना है, यही किशोरावस्था का दौर है जिसमें आ रहे बदलाव को समझना है। भटक ना जाए ध्यान इधर से उधर, ये याद रखना है, हो ना जाए कोई अनजानी चूक, ये ध्यान रखना है। यही किशोरावस्था का दौर है जिसमें एक एक कदम समझ के रखना है। With this, I would like to begin with my talk. Next slide, please. Adolescence, as we can say, it's a transition from childhood to adulthood. It's a sensitive and important phase in an individual's life. The girls aged 10 to 19 years, they comprise about 22% of our population. These girls, when they become adolescent, it's a period of storm and stress. Next slide. Next slide, please. A child's smile shows happiness, but a teenager's smile means something up. Something is cooking up in the mind. बच्चों के मन में क्या है, इसका अंदाज लगाना मुश्किल है. Sometimes these teenagers and adolescents, they have a myriad of physical, hormonal, psychological, and social developmental changes. Next slide. They go through these myriad of emotions. So you should be prepared for the low moods, the temper tantrums, the anger, frustration, and also the suicidal tendencies. The common teenage problems these teenagers face are low self-esteem and body image, stress, bullying, depression, cyber addiction, drinking and smoking and other substance abuse, unwanted pregnancy, and unsafe sex practices. Next slide. Now, who influences these adolescents more, parents or peers? In this age group, आई-वडिलांचे सल्ले नकोसे होतात आणि मित्रांच्या दबावाला मुलं बळी पडतात. So the peer pressure. Next slide. Next slide, please. Peer pressure is not a new issue in our India. It's been there since ages. But this social media has taken it to a whole new level. For example, sex texting. It's a cause of concern among the nowadays in the teens. These teens, they share explicit photographs and inappropriate content on the social media, and then they are being pressurized into doing this. As more and more kids, they fall prey to these pressures, they indulge in unsafe sex practices, doing drugs, and even bullying other kids. And day to day, these practices, then they become the behavior. Next slide. Habits and behavior have a lifelong impact. Today's youth is confident and independent, but while they are developing these skills, they start taking risks. In this age group, the friends, they become more close to friends are become more close, and whatever the friends they suggest, they have an impact on the children. Next slide. They don't understand the implications of the actions they take and the consequences which may result. हमारे फिल्म स्टार्स ऋतिक रोशन ने कहा है, डर के आगे जीत है. Victory is beyond fear, and this leads to a bindas attitude amongst the adolescents. Next slide, please. The teens, they are heavily influenced by the mass media, and they want to feel different and to feel better. And because of this, the teens, they actually have a reputation of being wild. This leads to a high-risk behavior, and this leads to violence, unsafe sexual behavior, substance abuse, unsafe driving leading to injuries, poor self-care due to excessive use of social media and screen time, which leads to unhealthy eating, inadequate sleep, and poor physical activity. Next slide. Next slide, please. Most of the problems, they arise because of the ignorance of elders. Now, when both parents are working, then they are not able to give time to the teens. These teens, they feel neglected. And many times the elders are ignorant about what type of things they are watching on the television, what sites they are accessing. And because of this, and because of the lack of time, the seniors, they try to compensate by giving more amount of pocket money because they themselves feel guilty that they are not able to give time. And then this leads to more wrong practices. At the same time, many friends, they give misleading information. There are sometimes elder brothers and sisters at home who may be half informed or ill-informed. Wrong advertisements may be displayed. Bad messages are depicted through the TV serials, and nowadays there are many web series. Sometimes there are publications carrying false information, and while doing this, children, they fall into wrong practices. Next slide. Adolescents are particularly susceptible to the substance abuse, and the substance abuse is quite common in India. For example, tobacco, alcohol, and other injectable drugs. Now, why these people are using drugs like nicotine and alcohol? Sometimes the most common reason is the rising trend and the peer pressure. But sometimes it is just for the relaxation and fun, and sometimes to keep away boredom. Next slide. Substance abuse, as we all know, it's a rising trend in India, and it can range from a sporadic use to severe substance abuse disorders. The acute and long-term consequences can range from minimal to minor to life-threatening, depending on the substance that is used, the circumstances, and the frequency. Most of the times, the earlier the drug use begins, the more likely it will progress to more serious abuse disorders. And these drugs, they interfere with the brain development in a dose-dependent fashion. The more risk factors on an individual, the more risk factor an individual health has, the greater chance of indulging in drugs and addiction. Next slide. As you can see, tobacco and gutka is easily available. So the number of school children who are using tobacco are 5.1% in India. There are other forms of cigarettes and other forms of tobacco like cigars, pipe tobacco, then there is a snuff. They contain an addictive drug called nicotine, and this nicotine, it stimulates the adrenaline gland to release adrenaline. Next slide. And because of these drugs, these nicotine and all, these drugs, they directly or indirectly cause a pleasurable increase in the amount of dopamine in the brain. And that's why there is more and more indulgence in the drugs. Binge drinking, for example, has become very common, and it is very common even in the girls. Now, alcohol, we all know, it's alcohol or ethanol. It's an intoxicating agent, and it is produced by fermentation. It's a CNS stimulant. It is absorbed from the stomach, and it is metabolized by the liver. And alcohol abuse is mostly because of the, especially in girls, it is because of the tendency to experiment. Secondly, it can be because of the peer pressure to show that we are very fearless. Then sometimes there is a family history. They see their parents smoking and drinking, and they feel that this is a normal phenomenon. This all leads to increased incidence of accidents, injuries, unwanted sexual activities, and in the end, ill health. Now, next slide, as a person, as a teenager, next slide, continues to abuse drugs, the brain, it starts adapting to the induced surges in the dopamine, which are produced by the drugs. And then the brain starts producing less dopamine of its own. And this decrease, it compels the addicted person to keep abusing more and more drugs. Now, there are some inhalants which are abused, and the use of inhalants has also increased in the girls. And it is again because of the curiosity, the peer pressure, many times unemployment, nuclear families, low socioeconomic status, and sometimes poor social support. Next time. Next slide. The tobacco and the smoke. The tobacco smoke, it's a mixture of chemicals such as carbon monoxide or formaldehyde and many other ingredients which are mainly carcinogenic. And tobacco, it kills more people than obesity, especially in the Western countries. At the same time, society and media, they portray smoking and drinking as acceptable or even fashionable. And when the Bollywood stars, they endorse such things, the teenagers are quick to accept these things. वाईट गोष्टी लवकर आत्मसात केल्या जातात. And slowly, as I say, that as the drug abuse continues, slowly larger amount of drugs are required to achieve the same euphoric effect which they get. And this has now become very common. Next slide. Sometimes, the next slide, please. Many times, the commonly used prescription drugs, which may include opioids such as painkillers, antidepressants, they are also abused. There are certain illicit drugs which may include cocaine, heroin, then some inhalants, some synthetic marijuana, and these are abused by the teenagers. There is a study in 2017 wherein it was said that 6% of seniors in high school, they reported using marijuana daily, on the daily basis. And this use in the Western countries has exceeded the cigarette use, because nowadays the teens feel that it is less harmful than it was in the past. While going through this, while I was going through this material, I found that these drugs, they are marketed as bath salts, phone screen cleaners, then some markers, glues, spray paints, which even we don't know. Now the effects of these drugs, now these girls, they are those girls who are engaging in regular use of alcohol, marijuana, nicotine, or other drugs. They are associated with higher rates of mental health disorders, failed careers, and increased risk of developing addiction. These effects experienced by the drugs, they range from the CNS effects, they range from euphoria at one spectrum to increased paranoia, hallucinations, seizures, memory loss, and in the end, organ failure and death at the other spectrum. Next slide. Now the alcohol and the drugs, as we know, they can impair the brain function and the motor skills. And some teenagers, they have depression and psychosis as psychiatric comorbidities. And this leads to internal and external struggle between the teenagers. Next slide. Now, sometimes, now these problems, they need special attention and special care, because psychosocial adjustment is the hallmark of this phase of development. Timely and effective guidance is necessary. As we all in India have a close family and a good family atmosphere, many times we are able to correct these girls if we guide them at the right time. Many times, even normal individuals, they struggle with certain issues like relationship issues and careers. The parents, they don't know that their kids are also facing the same problems, because there's a saying in Marathi, "Apla to Raju and dusऱ्याचं ते कार्ट." So they never feel that my kid is also engaging in such kind of things. Now, next slide. Because of all these things, because of the vulnerability of this age group, the adolescents and youth are vulnerable to STDs and HIV. And attraction towards opposite sex is quite normal in this age. Adolescent girls, they have some misconceptions about the sexual feelings and sex-related issues. Unpredictable boyfriends, volatile relationships, and unrealistic imaginations can put them in problems. So sexual health awareness, as well as contraceptive usage and imparting right knowledge, is a must. But when these things, when they are into unhealthy sexual practices, they can lead to adolescent pregnancy. And this is the most unwanted side effect. Next slide. Next slide, please. Now, teenage pregnancy, it has become a major social problem. It is not only in India, in all the countries, it has become a social problem. And due to the social development in our country, many such problems like drug addiction, transgender, homosexuality, prostitution, and teenage pregnancies are arising. So it is important to educate and support the girls to encourage and delay the motherhood until they are really ready for it. Next slide. Next slide, please. Of the 20 million new sexually transmitted diseases each year, more than half are among young people between the age of 15 to 24. And this is alarming. Parents, school teachers, and healthcare professionals should have an open and honest talk with the teenagers. Parents may not be aware that their children are sexually active. So you should talk to your teen about sex, even if you don't think that your child is really engaging in sexual activity. 16व वरीस धोक्याचं उगीच नाही म्हटलेलं आहे. These problems are very common in every country, but 11% of world's teenage pregnancies, they happen in India. And this translates to 16 million people between the age of 15 to 19 who become mothers each year. Shocked, even I was shocked. Pregnancy at a, next slide, pregnancy at a very young age, especially an unwanted one, can lead to severe emotional and mental trauma to the girl. Pregnancy and childbirth complications are the leading cause of death globally, and especially in the middle and low middle income countries, accounting for the 99% of the global maternal deaths of women between the age 15 to 19 years. Next slide. The causes of the main cause of teenage pregnancy is the lack of education on safe sex and unprotected intercourse. So sexual awareness is very much necessary. A sexually active teenager who does not use contraception has a 90% chance of becoming pregnant within 1 year. And the potential behavior patterns for a teenage girl becoming pregnant include early dating behavior, high-risk behavior, lack of support, social support, some unhealthy environment at home, leading to stress and depression, delinquency and criminal behavior, exposure to certain domestic or sexual violence, and most important is the financial constraint. And this teenage pregnancy, the greatest threat of teenage pregnancy is the serious health concern, because it leads to higher rates of pregnancy-related complications like anemia, hypertension, hemorrhage, and unsafe abortions. In addition, malnutrition, sexually transmitted diseases, cervical cancers, and psychosocial issues are also highly prevalent, and they are the serious health threats to the young women in India. Next slide. As we move on, we see that problem of teenage pregnancies in India, it really needs to be addressed. COVID-19 pandemic, it has accentuated these problems. The lockdown had resulted difficulty in the teenagers terminating unwanted pregnancy. Also, at that time, access to contraception was also difficult. But these things, these teenage pregnancies, next slide, they result in, next slide, please. Serious side effects, right from school dropouts to mental and economic burden of raising a child at a very young age, to increased prevalence of malnutrition and undernutrition, to getting free, accessible, safe abortion services, which can lead to risky health decision. And the fourth point is most important, because many times safe abortion services are not available. The girls, they resort to over-the-counter abortion pills, or they may go to certain quacks for getting abortions, and they can land into septic abortions and serious health concerns. Next slide. So the teenagers, they need to understand the effects and the risk which is involved in the teenage pregnancy. The education is interrupted. There are serious health risks. While delivering, there can be a premature birth, a stillbirth, and in the end, it can lead to even maternal mortality. Next slide. So, coming to the end of the session, I would summarize my talk. Talk to your teen. Counseling, counseling, and counseling. Bring up any difficult subject which your teen feels uncomfortable. Have a heart-to-heart conversation. Don't give a lengthy lecture. Don't put direct questions to the teenager. Rather, give a listening ear to the difficult issues from which the teens shies away. And at the end, give a proper advice. I agree with Dr. Tuteja sir. He has said that when you teach your child the actual Lakshman Rekha. Next slide. Teenagers, when we advise, they should know their limits. Next slide, please. And should give value to our advices. Youth is the best asset of our nation. And by making use of that wonderful power, India can reach the superpower position. Thank you, everyone. And thank you for your patient listening. Thank you, organizers, for giving me this opportunity. And thank you, IAP and Dr. Satish Agrawal, sir. And I wish you all a very happy Holi in advance.
Thank you, Dr. Suyoga. Really and you very well things are facing. And you have very well enlightened on the bindas attitude of adolescent. Are there any questions? So we will move.
Minal madam, if you allow me one.
Yes, sir. Yes, sir. Please, sir.
Dr. Suyoga ma'am,
Yes,
because
sir.
all the speakers are saying, all the speakers have mentioned that teenagers or the adolescents should be provided privacy.
Yes.
Simultaneously, the parents should have an eye over them. So it shouldn't amount to spying. So how to keep a balance between the two? Like giving them adequate privacy as well as keeping an eye over them about their activities. We should not cross the limits, as you said, Lakshman Rekha. How to make the balance?
But right balance is giving enough time. That's the we should at the same time give privacy, but at the same time keep a watch on the activities, what material they are reading, what content they are accessing, what channels they are watching, and instead of giving continuous advices, keep a silent watch, and at the right time we can guide them that this is not good or this particular thing is not favorable for you. So that's the right way. I think counseling is the right way to guide them, because they should know and understand their limits. They should not cross the line. That's the basic of the talk.
Thank you, ma'am. Thank you, ma'am.
Thank you, sir.
Minal madam.
Yes, yes, sir. Thank you, Dr. Suyoga. Now over to our second talk. Our second speaker, Dr. Abhinay Dharwade. He will speak on self-defense of the girls. Dr. Abhinay has done DNB, MNAS, DCH, MBBS. He has done diploma in counseling psychology. He is the owner of Sangopan Children Hospital, Dhule. He is the director of Shraddha Specialty Hospital, assistant professor, medical college, Dhule, and founder and chairman. Over to you, Dr. Abhinay.
Thank you. Thank you, ma'am. So, am I audible?
Yes, sir.
Yes.
Yes. My slides are visible now?
Yes, sir.
Yeah. Thank you, organizers, to give me this opportunity to tell something about the self-defense, about the girls and women. Actually, self-defense skills in women power or in pediatric or any gynecological conferences, why there is need of this topic, why this topic is here. Let me tell you that the world is a dangerous place, and learning to defend yourself and the people you love from who would do you harm is important part of staying safe and being a more confident person. See the crime rate, the crime against women in Delhi from 2012 to 2018, we can see that there is increasing amount of rape cases and kidnapping. And this is a hall of shame for Bengal, particularly because from 2006 to 2014, we can see that cases of domestic violences are increasing day by day. There are victims of rape, and in that 298 rape victims are below 6 years of age. So why self-defense is important? I think these numericals are telling themselves. The definition wise, the self-defense is the training and technique necessary to defend yourself when targeted by crime or violence. This is nothing but an ability to defend yourself and your loved ones. The primary importance of self-defense is for women to be able to protect themselves against anything that's unacceptable in terms of social conduct. And always remember की मला कराटे आले पाहिजे किंवा मला काहीतरी वजन उचलता आले पाहिजे किंवा माझी बॉडी खूप चांगली असली पाहिजे, माझं फिजिक खूप चांगलं असलं पाहिजे, नाही. So the basic self-defense does not requires you to lift 100 pounds or running 5 kilometers per day or spend your hours in a karate class or in gym. Rather, you already have all the tools you need, because protecting yourself is like any other skill. It's something you can learn with knowledge, practice, and determination. When we are confronting unpleasant situation, like some psychopath is standing in front of Kiran and saying kaka 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 Kiran, or मैं तुम्हें भूल जाऊं ये हो नहीं सकता, और तुम मुझे भूल जाओ ये मैं होने नहीं दूंगा, type of situation if created, then lots of adrenaline situation will be there. And then we all know from first year of our MBBS that this physical indication of fight and flight response is very important. And this fight and flight response will give you dilated pupils, trembling, sweating, pale and flushed skin, rapid heartbeats and breathing. And then the important thing is that you have to use your mind in that situation. Avoidance is the best self-defense. You have to avoid that unwanted person first. Mind game is also one of the important weapon. Being aware of and avoiding potential dangerous situation is one of the useful technique of self-defense. Attackers will typically select the victims they feel they have an advantage against, such as greater physical size or numerical superiority, but don't show them your weaknesses. मैं डर गया हूं, ये मत दिखाओ. De-escalation by verbal self-defense. No need to cry for help anymore. Your aggression will do it for you. Our best actor, that Sunny Deol, taught us many times in Bollywood movies that shout loudly, scream loudly, build anger and release anger will do best for you. At least say, mere Karan Arjun aayenge type of situation, that, and play mind games ki koi aayega. Main darne walon mein se nahi hu. But don't think too much about the laws and penal codes at that time. कि अब मेरा क्या होगा? I have to face to अंधा कानून for so long कि मैंने अगर ये कर दिया तो तारीख पे तारीख, लेकिन इंसाफ नहीं मिला. My lord, इंसाफ नहीं मिला, मिलती है तो सिर्फ तारीख type of situation is not important here. Remember, self-defense is not an offense according to law. So just think at that time कि जब ये ढाई का हाथ किसी पर पड़ता है ना, तो आदमी उठता नहीं, उठ जाता है. Section 96 of Indian Penal Code states that nothing is an offense which is done in exercise of a right of private defense, while Section 97 states that every person has a right to defend his own body. He might thought, that attacker might thought that you are a flower, but tell them, Pushpa naam sunkar flower samjha kya? Fire hu main jhukega nahi. Many people have some misinterpretations about the self-defense, like deliberately jumping in the situation like, Teja, tum log mujhe dhoond rahe ho, aur main tumhara yahan intezar kar raha hu. Hai. Unnecessarily kisi ke saath panga nahi lene ka. This is again an important rule of self-defense. If moderator is fighting with faculty, is not allowed in any conference. And the important thing is that always identify potential threats in your life. Be alert always. Use your sensory systems wisely, that someone, somewhere can do any harm to you. So always be prepared with your eyes, with your ears, with your all sensory organs. Situation can be there in anywhere. That situation in elevator. Suppose you are single and there's lonely, you are traveling in elevator and there is someone who enters there. Then always face to door. And always remember that if you are in elevator and suspect enters in that lift, then press all floor buttons so that no one dares to do any criminal activity in an elevator which stops at every floor. This is again an important thing. Situation can be there in taxi or cab at a night time where you are traveling lonely. If you take a cab, always photograph the number plate before you get in. This is again an important thing. If you are traveling in a taxi in the night, then call your loved ones and say, Daddy or Mom, and tell them that I am in taxi with this number, so that he will think twice before committing any crime. Know who to call in an emergency. Sit in the back seat, not in the passenger seat. Always remember, keep expensive items hidden and keep your things close. वो टैक्सी वाला देख रहा है मेरे पास एक्सपेंसिव एप्पल का मोबाइल है, मेरे पास बहुत बड़ा गले में कुछ चेन है, नेकलेस है, मेरे हाथ में बहुत सारी अंगूठियां है. So I am welcoming him. I am giving him निमंत्रण कि आजा लूट ले मुझे. So keep expensive items hidden and keep your things closed. Ride with the windows closed or nearly so and your phones handy. This is again important. That situation in a parking area or lonely roads in the night, there are a variety of precautions that you can take to ensure your safety while walking at night. When walking at night, make sure you walk confidently and with purpose. Plan your routes. Make sure your hands are free. Avoid being distracted by your cell phones, that earphones we are using with and listening music, the lonely roads. This is again dangerous, that your sensory organs are not working. They are getting distracted. You are using your mobile screen. That means your sensory organ, your eyes are getting distracted. So make sure your hands are free and avoid being distracted by your cell phones. Carry a deterrents. Carry non-violent deterrents like whistle, pepper spray or mace. Use a flashlight or bike light. Use busy, well-lit paths. Avoid dark areas. Wear reflective clothing and comfortable footwear. Steer away from suspicious people. Walk with a friend or with your pet dog. Notify someone that you are there on a lonely path. Trust your instincts. This is again an important thing, that you have to trust your instinct. Avoid being distracted by your cell phones and avoid dark alleyways and parking lots where people can easily hide. Make sure someone is aware that you will be walking alone at night in case of an emergency. Remember that situation can be anywhere at any time, while being on the roadside also, while walking in the alleyways also, while asking for someone to lift yourself for traveling, or at your doorstep also. See who is there at the door before you open it. Look through a window or a keyhole to make sure it's safe and then only open. If you are alone in a stranger area, then prefer CCTV zone to minimize the potential risk. Walking home alone and feeling uneasy, getting a weird vibe from a stranger on the bus. Many of us have been there. In a January 2018 survey of 1,000 women nationwide, 81% reported experiencing some form of sexual harassment or assault or both in their lifetime. Verbal harassment was the most common form, but 51% of women said that they were touched or grouped in an unwelcome way, while 27% of women survived sexual assault. But while doing this survey, there are 5% women who don't know about how to do a self-defense or how to be aware about this situation. So be loud to intimidate the attackers and create attention in case of somebody is nearby. Stay in well-lit area. If you park during the daytime, then consider what the area will look like when you return at night. Make sure there is an ample of lighting there. It is handy to attach a whistle to your keychain to frighten potential attackers and get help quickly. Make sure your cell phone is charged for emergency cells. And the important thing, that wear your jacket over your purses so your valuables are less exposed. If someone enters inside, say thief, then pepper powder, mirchi powder is again an important weapon for self-defense. Focus on the vulnerable areas. How to stay safe if you aren't physically able to protect yourself. Learn to develop boundaries, even with the people you know, where or how to get practice. Again, these are certain important areas where you can focus while fighting with for the self-defense against that criminal person. Memorize vulnerable spots to attack. It doesn't matter how big or strong the attacker is. They're vulnerable. These vulnerable spots are their weak points like eyes, nose, throat, solar plexuses, groin, knees. Various fighting techniques are available. You can use these techniques very easily. And hammer strike, groin kick, heel palm strike, elbow strike. These are again karate and kung fu and taekwondo strikes, but these are simple self-defense techniques. And anything in your purse, anything in your purse can be a weapon for you at the tricky situation. Your belt, your tie, your shoelace, your umbrella, your comb, your water bottle, purse belt, purse, mobile, torch, keys, even your safety pins, magazine roll or paper roll, pen, fire extinguishers, paper powder, hot tea or coffee cup, hot water, wristwatch, sanitizer bottle, handkerchief, dupatta. You always carry weapon with you in your purse. So always remember these can be turned a weapon in tricky situation. Could do more harm if you put these keys in your hand like this. The important thing that they will focus on the weaker parts of that attacker, and then you can attack at this time of situation. Even your umbrella can work as a weapon. Even your paper roll or a magazine roll can work as a weapon. Your comb can be used as a weapon. You can see here, your comb can be used as a weapon. Your cup, your coffee mug can be used as a weapon. Your Coca-Cola or a cold drink bottle also can be used as a weapon. Your purse can be used as a weapon. So why the self-defense is important? Safety, it gives you confidence, it gives you empowerment, discipline, reduces dependency, health and fitness, and reduces discrimination and sexism. This is an again important thing that Gulabi gang, the Rose gang, started in rural Uttar Pradesh by a group of women headed by Sampath Pal Devi that held sticks, that means lathis, in their hands and spoke against domestic abuse and gender violence. It was primarily aimed at removing officers who did not register cases of crimes against women under the influence of money. This gang grew to include community service efforts in food and grain distribution to villagers, teaching self-defense to women as well as empowering of women to be economically self-sufficient. So a woman must equip herself with the simple self-defense techniques to catch an attacker off guard and show him the consequence of misbehavior. Even the basic style of self-defense is better than no defense at all. As Ronald Reagan says, that self-defense is not only our right, but it's our duty. So stop violence against women. This is again an important message. Fear has two meanings. Forget everything and run, or face everything and rise. The choice is yours. तू ना थकेगा कभी, तू ना रुकेगा कभी. कर शपथ, अग्निपथ. So life is Agnipath and self-defense is our duty. So the world is a dangerous place. We have to learn self-defense techniques with available resources in your pockets, in your purses. Thank you so much.
Thank you, Dr. Abhinay. It was really a wonderful talk. You have made your talk very lively and interesting with voice modulation and by depicting pics and sayings Bollywood movies. Actually, this self-defense should be imbibed in the adolescent age group, right from the school age group, because these are young minds which are creative and they accept change. And so have to change, have to change society, and so it should be started from the adolescent age. And really a wonderful talk. Thank you very much.
Thank you, ma'am. Thank you.
Are there any questions? I think everyone got mesmerized with your talk.
Thank you. Thank you so much.
Thank you. So we will start with the Next talk. The next talk is Making Elderly Women Safe at Home by Dr. Arpita Patskavde. Dr. Arpita. Dr. Arpita is a senior physiotherapist, Radiant Super Speciality Hospital, Amravati. She is experienced in treating ICU patients, HDU patient, trauma ICU, plastic surgery ward, and geriatric. She is an ex-assistant professor, Ullas Patil Medical College, Jalgaon. Over to you, Dr. Arpita.
Thank you so much, ma'am,
Dr.
for this
Dr.
warm welcome. Yes, sir.
Dr.
Yes, sir.
Just a minute.
Yes, sir.
We acknowledge the presence of Dr. Vaishali Yohare, ma'am, the MMC observer. Dear Arpita, you may continue.
Okay, sir. Thank you so much, sir. Thank you, Minal ma'am, for such a warm welcome. Good afternoon to all the dignitaries. And I feel very fortunate and that all of you have given me this opportunity to speak on IAP platform. So I would request Mr. Prashant sir to start up with my slides. Yeah. So my topic for today is physiotherapy role in geriatric female, and all the exercises which I would be discussing here, the female can do at home very easily. So I would start off with my presentation. Goal setting. When it comes to elderly population, the first and foremost thing which comes in our mind is that we have to make them independent. Independence, like they should not feel that they are a burden on the family or on the society. So here we have to make them independent, and for that we have to train them accordingly. The second goal is to relieve pain which is occurring due to musculoskeletal problems. Then sorry, so the slide is getting changed. Yeah, yeah, thank you. To improve range of motion of different joints, to improve to improve strength and endurance of movement, to improve cardiovascular endurance, to improve ambulatory status with paying attention on the balance, care of bowel and bladder dysfunction, and environment adaptation. This is just enumerated what I have enumerated what I'm going to briefly explain in my presentation. Going ahead is, next slide, please. Deconditioning. This is a term when old age people, females, generally because of pain or because of immobility, they are scared of using their limbs. So this causes, when there is lack of use of their limbs, then definitely the condition which is occurring is deconditioning. So deconditioning, it could be either an effect or it could be a consequence also. The reasons could be impaired balance, incontinence, immobility, and instability. The problems can be addressed by reconditioning through range of motion and other exercises. Next slide, please. The first and foremost thing which for elderly population we should use is pain management. They have enormous pain, and the pain is sometimes insidious, sometimes it is acute, chronic. So for that, the first and foremost thing which we give is generally medications for chronic pains. Second is, I would say that whenever there is most common condition like arthritis, so whenever there is joint swelling, then ice fermentation is must. And whenever there is stiffness or pain or cramping, then heat fermentation is required. Gentle mobility exercises, which I would be describing ahead, are very effective in reducing these symptoms. And regular practice of relaxation techniques. These relaxation techniques make the individual feel little comfortable and gives a relaxed state to the muscles so that they can function properly in basic activities of daily living. Next slide, please. Cardiovascular conditions. Like I'm enumerating the problem list first. So cardiovascular conditions, heart conditions like heart failure, arrhythmias, or heart valve complications, these are the conditions which severely affects the respiratory system as well as the circulatory system. So for these conditions, proper exercises, proper positioning should be given by a physiotherapist. And if it is guided by a physiotherapist, the elderly woman should practice it at her home. So this will help to lessen the complications after any kind of surgical conditions, any bypass surgery or anything. So these were the enumeration of cardiovascular diseases. Next slide, please. Musculoskeletal problem. The most common conditions which we see in musculoskeletal problem is osteoporosis and osteoarthritis. As you can see in the image, a porotic bone is more likely and very fragile. Even a trivial fall, even a trivial fall can cause the bone to get fractured. So it is most common in females, as females after the age of 40, they start losing their calcium levels from their bones. So this becomes more severe when the age is advanced. So osteoporosis is a condition wherein there is increased chances of risk of fractures. Osteoarthritis, on other hand, as is shown in the other image, it is a condition where there is inflammation of the articular cartilage. This occurs because of wear and tear of the joint. जे आपण इतक्या वर्षांपासून हाडांची झीज होते ते म्हणतो. So because of this wear and tear, the pain and difficulty in walking, these are the main problems. And as we have seen in older adults, standing and knee pain, this is the most common problem they come with. That is osteoarthritis. Next slide, please. And the most common thing is fear of fall. Before falling, even if the muscles have strength, so they could hold it on, still there is a fear of fall. So this fear of fall is because of impaired balance and less amount of mobility. So the causes are numerous. It could be impaired vision. It could be some side effects of particular medications or environmental hazards or any post-surgical conditions which makes the muscles all the more weaker. So fear of fall can be, this fear can be removed from the older age group females if they practice exercise and if they get little more motivated and confident about themselves. Next slide, please. So the basic standing, like all the elderly, they feel very embarrassed when someone or helps them or give assistance. The newer ones who are entering into the older age. So some assistive devices like wheelchair, walker, sticks and elbow crutches can be used, and wheelchair is for avoiding longer distances walk. One thing I would like to add on is whenever they are sitting at one position, so there is a major complication that there is pressure which is getting imposed on the bony prominences. This could lead to bed sore. So even if assistive devices are there to help, we still have to avoid the pressure sore areas. Next slide, please. The first and foremost is increasing and improving the balance. So I have just mentioned shown the images. Like there are first image is tandem standing. In this, as you can see, the female is standing with one left leg heel touching the right leg toe. So in this position, she has taken a support of a chair. This position, even if we stand without support, after a few minutes, we would feel that no, my balance is getting altered. So here what happens is the muscles are getting contracted and the base of support is decreased, which leads to alteration in the line of gravity, which falls. So it challenges your balance. And if an older female practices this regularly at home, then definitely she will improvise and the strength of her muscles would increase. Next is one leg balance. Here, the female has completely, sorry, the previous slide, sir. Yes. So the female has completely taken her toe off the floor and she is standing with complete support and she is able to stand. In the third image, we can see there is standing in hip raise. So all these three exercises, this also strengthen your pelvic girdle muscle. Once a female is practicing it on a regular basis, then she gets confident and she can walk and stand with confidence. Next slide. Now there are some equipments also, which are commonly used in rehab centers. This can even be taken at home and practiced. So standing on a balanced disc, so the disc is shown as in the first picture. A female is standing, and here the co-contraction of muscle is occurring: hamstring, quadriceps, and gluteal muscles, and your lateral thigh muscles. So this challenges the balance and helps co-contraction of muscle, increasing the circulation, thus improving the strength and confidence for proper balance. Next is standing on a balance ball. So balance ball, it provides pressure on the feet, and this all the more alters your balance. So these are the exercises for balance training. Next slide. The aerobic training is very important. It uses maximum oxygen, and in older age group, your lung compliance needs to be taken care of a lot. So the most common exercise for aerobic training is simple walking for older age group. So it uses larger muscle groups like legs and causes heart rate to increase for a certain period of time. So aerobic training is very easy and important. Walking is probably the easiest form of aerobic training. Next slide, please. So thing which we have to remember is we have to stay hydrated when we are walking. And there is a general adaptation of a faulty posture by older people, females. It is not because they do it purposely. It is because there is pain, enormous pain, which causes anterior tripping of shoulders, forward head posture. So we should encourage them. A therapist needs to encourage them that you have to stand straight, be relaxed, keep your head straight, and stand high. So standing straight with shoulder and back relaxed. And in walking, if we want them to intake more oxygen, then definitely we should tell them to swing their arm up, lift their arms up, and do some arm exercises as well. And whenever they are tired, we should advise them not to pace up, just take some rest. Next slide. Yeah. I'll move on to the strengthening exercises. So as in the first image, the female is seated comfortably on a chair, and she's lifting her arms. You can give initially some half kg weight, or without weight, you can at least tell her to do the exercise. Any exercise, according to a physiotherapist, it should be at least started with repetitions of 8. Earlier 8 repetitions, which should be successively increased once the endurance is increased. And there is biceps curl. Definitely not these many heavy weights should be given. Initially, the weight should be half kg or 1 kg. So biceps curl is there, and shoulder shrugs. The trapezius muscle, it is very important muscle, as the older females, they are maximum females, they hold their crutches. तो जैसे ही वो क्रच पकड़ती है तो she has a complaint कि माझा हाथ दुखतो है, माझा मान दुखते है. So in our center also many females come that they have severe knee pain, neck pain, and shoulder pain. So we always forget that we have to strengthen the upper musculature so that these assistive devices at a later age can be used very properly and easily. Next slide, please. Strengthening exercises for lower body. All the exercises initially it should be done supported, and later on we can do it unsupported if the female is comfortable. So leg extension, it causes gluteal contraction, and it is performed against gravity. So it increases the muscle contractile power and more amount of circulation is there. So this causes strengthening of the gluteal muscle within a certain span of time. Next is heel raises. Heel raises is a simple exercise which we have to just take support, ask the grandma to take support, and then raise her heels up. This causes stretching of your calf muscles also, anterior thigh muscles also, and pumping. Calf muscles are the like pumping muscles only. So many a times cases like DVT, deep vein thrombosis, or any such venous conditions, they can be dealt with when these exercises are being performed. The third exercise is hamstring curl. We should ask her to just lie down in prone position initially and then just flex her knee and lift slight amount of her hips in an extension position. And these exercises should also be done initially at 8 repetitions. Later on, it can be progressed to 10 to 15 repetitions. Next slide. Supported squats. Even if at our age when we do squats, it is little difficult, like we feel pains and all the next day because of the delayed onset muscle soreness. So supported squats in elderly is very beneficial also, but it should be supported, not unsupported, and it should be till the tolerance level of the female. And it helps in co-contraction of your hamstring muscles as well as your quadriceps muscles, and this gives more good results in strengthening exercises. Abdominal crunch. I would like to specify very clearly that in abdominal crunch, I mean, if you see the image, the female has just lifted her upper back, that also little bit. She has not done the complete crunch. So I would never advise the patient, I would never advise the female to do a proper crunch. No, I would advise her that how much ever it is tolerated by her, later on she can progress. And this is how the abdominal muscle strength can be increased. Because many females, they have pelvic muscle or weakness. Many times they have upper back pain, neck pain. So we don't have to aggravate. We just have to help them, aid them in relieving their pain with increasing the strength. Next slide, please. Stretching exercises. Stretching exercises is basically static stretching where the muscle tendon unit under a slow, gentle stretch is maintained for 20 to 60 seconds. With your older age group, the most common phenomenon which happens is there is shortened muscle tendon unit, because of which whenever there is maximum cases comes with a muscle pull many a times, doing a simple activity and they have a muscle pull. So stretching exercises can be done by females, and it is important for increasing the uh, contraction period also, as well as increases the circulation and flexibility. Next, please. Yeah, urinary incontinence. This has been taking a boom nowadays, because earlier also this problem existed, but many a times older people, they lack confidence because they cannot roam around with the peer group in a garden even for a walk. They hesitate a bit. This is because there is urinary incontinence in old age in some people. It urinary incontinence means person leaks urine by accident. So overactive bladder is most common in geriatric population. The reasons are weak pelvic floor muscles, damage to nerves that control the bladder due to conditions like multiple sclerosis, diabetes, and Parkinson's disease, pelvic organ prolapse, arthritic condition. Generally in arthritis, it is common as knee pain where the patient cannot go to the bathroom immediately. So urinary incontinence, it definitely causes a embarrassing situation for older females. Next slide, please. So we physios, we give a bladder control training to them. So this is basically pelvic muscle exercises. This is Kegel's exercises. Just to remind, pelvic floor muscles includes levator ani, coccygeus muscle, fascia, and associated connective tissue surrounding the muscles. Next slide. Next slide. Yeah. I have just given a diagrammatic presentation of Kegel exercises. As shown in the first image, there is a musculature which is shown of pelvic musculature. Here, the female has to lie down in supine position and crook lying position comfortably. Then she has to tense the pelvic floor muscle like the anus. She has to tuck it inside as if she's trying to stop from passing the wind outside. Then she has to tense around the vagina as if she's trying to stop the flow of urine. The third step is squeezing both the area, both the anus as well as the vagina, and suck up the belly button inside. So first is anus, then is your vagina, and then is the belly button inside. Next is this squeeze should be hold for at least 5 seconds initially, and then relax for 5 seconds. We have to repeat this squeeze with a lift, and this cycle completes the Kegel exercises. Kegel exercises, initially it is little difficult for them to understand, but once they practice it daily, they can do it very properly. And it is a boon, really. It has shown great results in controlling the urinary incontinence, and it has proven that old females are feeling more confident after performing these Kegels exercises, as it strengthens the pelvic floor musculature. Next slide, please. Breathing exercises. In this COVID scenario, the two exercises are pursed lip breathing and diaphragmatic. Older age group people, they have to cope up with various respiratory conditions also. So pursed lip breathing exercises in which the person will inhale with nose till the count of 1, 2 and exhale for a double count, that is 1, 2, 3, 4. This has to be repeated 10 to 15 times, better if performed in the morning and in the evening. Second is diaphragmatic breathing. As we all know, diaphragm is a main inspiratory muscle. So its functioning is really very important. So here you have a person when inhales, the diaphragm, it domes down and the belly is out. This is the vice versa situation in the normal breathing. Generally, people tuck in their abdomen and then they breathe. So no, you just have to inhale and bring the belly out. And when you're exhaling, get the belly inside. The dome shape of the curve in the second diagram as it is shown is completely achieved. So this increases the diaphragmatic strength and thus helping to deal with the respiratory conditions. Next slide, please. As older females, whenever they are walking for a certain time, they start panting. There is shortness of breath, just dyspnea. So there are some positions I would just like to enumerate. Like in the first position, the female is leaning forward and she is taking support of her accessory breathing muscles. And then she's performing the pursed lip breathing exercises, which I have shown in previous slide. Whenever if she is walking somewhere or doing some activity, then she just have to take a support, lean ahead and start doing performing exercises, breathing exercises, and same can be done in sitting. Next slide. Home environment modification. It is this is the zone which is mainly neglected, or many a times it is not even considered in Indian scenario. I would request that when elderly people are there at home, then as shown in the first image, there is a chair under the shower which will help them to take bath. There are bars situated alongside of the commode which will help them to get up from the seat. Then there is a proper chair which is given with which they can take bath completely supported. And while climbing up the stairs, there are staircases and there is harness which they could hold the handle and then they could ascend and descend the stairs. So these are some home modification. Next slide. Dementia. It can be defined as depletion in cognitive performance, which enables elderly to meet multiple intellectual demands of daily life. So in physiotherapy nowadays, there is cognitive training which can be given. There is a virtual reality technology. I won't say that it is only there in rehab centers, but it can also be given in, the setup can be done at home also. So here it is a technology which refers to high-end user interface that involves real-time simulated interactions through multiple sensorial channels, providing direct sensorial feedback. Next slide. So here, just an image would be sufficient. There is a setup, and I'm treating a patient he is having loss of his balance. So this virtual screen gaming will move according to the patient's movement, body movement. So in order to gain the points, they feel very motivated and they feel very happy that yeah, we are able to do it. So in guidance with physiotherapist at rehab center, and when this setup, this software has been uploaded at home, definitely with kids, elderly can be involved to play these games. And VRT, virtual rehabilitation training, it is really helpful in dementia patients, increasing the balance as well as cognition. Next slide. Yeah, thank you and regards. Thank you so much.
It was really, and I is really much elderly. And I think every woman after 40 strengthening, stretching, and lifting, weightlifting exercises regularly.
Yes,
And
yes.
you have very well enlightened environment. And thank you very much.
Thank you so much, ma'am. Thank you.
Are there any questions? I think there are no questions. Thank you. Thank you,
Thank you, ma'am.
organizers of IAP. Thank you very much.
Thank you very much, Meenal Deshmukh ma'am, for chairing this session. I will also like to thank Dr. Suyoga Panak ma'am, Dr. Abhinay Darwade sir, and Dr. Arpita Pachkode ma'am for having such a brain boosting session. I now welcome Dr. Shalaka Bari ma'am as a chairperson for our next session. Ma'am is a consulting gynecologist at Bari Multispeciality Hospital and Best Multispeciality Hospital. She is a chief editor of Mind Spark in 34th edition of AMO GS. She is a souvenir of monthly magazine Bites and Mindstone. She is also a secretary of our OBGY Society Amravati. Over to you, ma'am. Dr. Shalaka Bari, ma'am. Over to you.
Hello, am I audible?
Yes, ma'am.
Thank you, respected organizers, for the opportunity. So as we come to the most important part of today's conference, the panel on adolescent ball care, I would like to welcome our moderator for today's panel. And it's my proud privilege to introduce Dr. Jayant Pandekar sir, who is a well-known pediatrician of Amravati and a very humble person. He's the director of Sushrut Maternity and Children Hospital Amravati, Life Care PICO and NICO Amravati, the director of Ambadevi Sansthan Hospital Amravati, and a president of Maharashtra State IAP 2020 and 21. Welcome, sir. Over to you.
Can you hear me?
Yes, sir. Yes, sir.
Okay. So let me allow to share my screen. Mr. Prakash, please let me allow to share my screen.
Yes, sir. Just a second, sir.
Okay.
Sir, please share your screen, sir.
Thank you. Well, at the outset, let me thank. Okay, I'll just allow Dr. Swati Ghati to get in the for panel discussion. I hope Dr. Swati has joined. Dr. Swati, have you joined?
Joined.
Okay, thank you, sir. So, at the outset, let me thank the organizers, convener of this today's great CME on women's care, none other than our enthusiastic, dynamic senior pediatrician, Dr. Satish Agrawal sir, for organizing such a wonderful one day long webinar on exclusively on women's care. I must thank Dr. Naresh Taide, Dr. Sushil, on all the team of IIP Amravati. Basically, we all celebrate World Women Day on every 8th March, and we have celebrated just a few days back. It's not just one day function. The main aim of celebrating Women's Day is to empower the women. And it's not that only in one day we can empower the women, but it's the continuous process. It's a continuous ongoing process of empowerment. And that's why I must thank specifically to Satish Agrawal sir and team for organizing such a wonderful CME, which is a part of continuous empowerment program as a continuous medical education. What better can be there for women empowerment is the woman's health. So whole one day long CME he has organized, which includes the healthcare of infant girl to the geriatric woman. So he has included each and every age group of the woman and each and every aspect of the woman. So hats off to you, sir, for nicely organizing this webinar, including all these topics. So let me talk about this this figure. Just on 4th March, the Indian population was 141 crore 56 lakh 53,821. Now, just yesterday, when I googled, now it is become some 67 lakhs and something thousands. So we have overtook as far as the China, as far as the population of the any country is concerned in the world. Now, why I'm showing the statistics when we are talking of women? The very reason is that I'll share with you the vital statistics of population of the country. Let me tell you, I'm very happy to share you that on November 26, 2021 census, we have crossed the ratio of male as to female in India. Now there is a 1,020 women for every 1,000 men. So I would say this is a really great success of the PCP Act, which was launched a few years back. Thanks to all OBGY members and thanks also to caretakers of the woman. Another most important statistics is that even today, the sex ratio at birth in India is 1,000 male, 991 female. This is the latest sex ratio which is shown as far as the at birth is concerned. Still, we are lagging behind in this ratio, but definitely we have improved it from 938. And now we have gone to 991. So once again, thanks to them. Out of this total, this 141 crore, total adolescent population is almost 20%, 22%. Statistics may vary 1 and 2% here and there, but from 10 to 19%, more or less it's a 21, 22% of adolescent population. And there is a 28% population is between 10 to 25, what we call as a young adults, because from 10 to 19, we call it as a adolescent age, and from 19 to 25, we call it as a young adults. Because this is also a very sensitive age group, that is from 19 to 25. They are neither labeled as a so-called matured or not labeled as a adolescent, but this group can be called as a young adults and must be included in the adolescent age group. So let me tell you, India has the largest adolescent population in the world, amounting almost say 28 crore. Just imagine. And if you consider the population ratio of the male-female ratio in this, we have almost say 15 crore of teenage girls in India alone. So once again, let me thank organizers for organizing such a wonderful exclusive panel discussion on adolescent girl care. Today, I have esteemed panelist with me, Dr. Swati Ghate. She's from Jaipur. She's a exclusive adolescent health specialist practicing exclusive adolescent health practices at the Bloom Center for Child and Adolescent Care at Jaipur. And she's head of Babylon Newton Center, CDC at Jaipur. I can tell you so many things about Dr. Swati, and she is not only a national speaker, international faculty for the adolescent health. She has not many research papers to her credit, and she was one of the main advisors to the government of India while starting school reopenings after post-COVID area. So welcome, Dr. Swati Madam from Jaipur. Then I have one more senior gynecologist, leading gynecologist from Amravati, Dr. Pranjal Saraswat Sharma. We all know she is a very dynamic lady, most active in the OBGY society, not only at the city level, but at the state level and at the national level also. She has organized many conferences. She was organizing chairperson for Adolescent Zonal Conference of AMOX, and she was organizing chairperson, so secretary for AMOX 2020. We all witnessed, and we all know the zeal with which she worked in the field of adolescent medicine. So welcome, Dr. Pranjal, madam. Then we have one more panelist, Dr. Rajesh Bhu. Basically, his field of interest is not adolescent medicine, but he's expert in the field of nutrition. And let me tell you very proudly that he's the first person who has started this human milk bank at Amravati. And he's instrumental in organizing and arranging the human milk banks all over the central India, that is in Nagpur, then in the Chhattisgarh area, then in Rajasthan and Gujarat as well. So welcome, Dr. Rajesh. So with this, welcome to all the panelists. I start with my topic, that is adolescent girl care. We all know what is teenage. It's a age of transition from childhood to adulthood, and usually corresponds with the age of 10 to 19 years, plus minus here and there. And this is the most vulnerable period. This is the most delicate period where all the changes are being taken place under the hormonal control. And we all know what those changes are, like physical changes, growth, development, then mental changes. Here, let me tell you that the mental maturity is not that much as compared to their age, as compared to their physical maturity. So there are problems, some of problems with the mental health issue. Then, of course, these are the changes where it faces the social changes. Here, he or she wants to become a social, and she faces so many social problems. This is the age wherein she's undergoing a lot of sexual changes, undergoing sexual development of secondary sexual characters and other things. So this is a lot of this is a period when she's undergoing a lot of emotional turmoil, lot of emotional behavioral problems. So many these changes which are taking place during this very delicate period and of adolescent care. So how is teenage? T is just a small mnemonic. She is just, they are like thoughtful and thoughtless. They are sometimes very energetic, sometimes they are nervous, they are always experimenting, they're always emotional as compared to their counterparts, boys. So we all know the teenage girl is more emotional as compared to their teenage boys. No doubt, boys are more naughty as compared to girls, but girls are also at this age, but they are more nervous as compared to boys. This is the age when they require assuring, they require guidance, they require, they are also the age of guilt feeling. And of course, this is the age of envy and enmity, once again, more so in the female girls, the teenage girls as compared to boys. So these are the few features of this teenage girl. Okay, these are changes once again, what we have discussed. Now I begin with, let me tell you here, this adolescent girl care is a very vast topic, and it's like having a panel discussion on pediatrics, or it's like having the panel discussion on whole medicine. It's like that only, because adolescent healthcare itself is a big specialty, so we cannot have a panel discussion on that. So that's why we have thought that we should pick up the topics, the three simple topics which are important and relevant for this age. Now let me comment about the important aspects of teenage girls. I'll just go through this slide. It's a nutrition, growth and development. We all know immunization is also very important at this age. Then there are menstrual problems, sexuality, relationship issues. Then this is a period of identity and autonomy. A lot of psychological problems they are facing. A lot of social issues these girls are facing. A lot of behavior problems they are facing. There is lot many pressure, peer pressure, media pressure, problematic internet use, gender issues, substance abuse, date, rape, drugs is a very common field we come across. Then there are difficult teens. It's difficult to manage these teens for the parents, for the teachers. And then there are legal issues. There's the POXO Act, exercise, lifestyle issues. So there are multiple facets to this particular today's panel. So what we have decided in our panel that we'll restrict our discussion to the three main topics, that is mainly on the menstrual problem, then mainly on the psychological issues, and mainly on the nutrition. So with this brief introduction, once again, I welcome all my esteemed panelists and delegates. So these are the common pressures for adolescents, like peer pressure, then the media pressure, family pressure, gender pressure, societal pressure, study pressure, all those pressures they are on the adolescents. So with this introduction, I now start with the discussion on the common menstrual problems. My question to Dr. Pranjal Madam is that, Madam, there are so many problems in regarding menstruation in a teenage girl, but can you enumerate what are the common menstrual problems which a teenage girl come across?
Good afternoon, everyone. Sir, I'm audible.
Yes, please go ahead.
First of all, let me congratulate Dr. Satish Agrawal, sir, Dr. Pandrikar, sir, and Dr. Naresh Tayed, sir, for this mind-boggling conference. It is really since morning. There are so number of interesting lectures. In spite of Sunday, I know that we are stuck up to this conference. Thank you, sir, for making me part of this panel discussion. Girl, whenever a teenage girl, she enters, like she's achieving, like she's just crossing her she's childhood and she's entering, she will start having her menses. That is after menarche. Menses maybe in some percentage of the girl, they may be not, they're very from the normal. Some kind of problem these girls they face. Very routine problem which the girl faces is either she will be having dysmenorrhea, or there are some varieties of the dysmenorias, or some concomitant physical issues like having vomiting during this painful menses, or either she will be having headache or something like that. So it all can be clubbed under the premenstrual syndrome. As her H2O axis is yet to be stabilized, these girls usually tend to have irregular menstrual cycles. They may be having oligomenorrhea. Unfortunately, some girls they can have the puberty menorrhagia, and problems like metrorrhagia also can be there. Sometimes due to some other condition which are very common nowadays, like it is a you can say that now there is we are facing a big problem of PCOS. Because of that, many other menstrual problems they are expected to come in these type of girl, but the main problem which these girls they suffer and they do come to us is a dysmenorrhea.
Thank you, Dr. Pranjal Madam. Now let us discuss some case scenario. This is a Miss Paru, 13-year-old, having BMI 17, history of severe pain in lower abdomen, vomiting since morning. This all started since today morning with arrival from menses. How will you approach this case?
This is again a case of, I can term it as a dysmenorrhea. This is a primary dysmenorrhea. Miss Parul is 13-year-old, and she is within well range of her BMI. So this dysmenorrhea is a very commonest problem. Almost more than 50% of the girls they suffer from the from this dysmenorrhea. There are crampy or severe lower abdominal pains related to menstrual flow. Because her cervix is too tight, the uterus try to expel all the endometrium and the blood out of that cervix. So in that effort, uterus has to contract sometime, and that is perceived as a pain by these girls, and this is a dysmenorrhea. Some lean thin girls, they also do show some symptoms like sweating, nausea, vomiting, diarrhea, etc. Because of this contraction. These radiating pains, maybe they're in the GIT, lower GIT, or it can be in the upper GIT in the form of vomiting. I can say that most of these can be functional also. So when a patient comes to the gynecologist, we have to differentiate between whether there is some exam or whether there is some pressureful things. Because of that, this girl is saying that she is having painful menses. So there are functional dysmenorias as well. They do come to us, but most of them are really, they need the treatment. And this is the main reason for absenteeism from the school. Daily routine is disturbed. So as a gynecologist, as a parents, we have to take care that these routines should not be disturbed, and they have to be taught nicely that it should be taken as a part and parcel of their life.
So, because as a pediatricians, these girls usually, they may come to us first, then we have to refer this patient to gynecologist for your consultation. Thank you. Now, since last 2 decades, we have seen that so many patients of PCOS we are seeing. I remember when I was a student way back in 1993, 94, 92, at that time, hardly we could come across these terms like PCOS or PCOD. But nowadays, since so many cases of PCOS we are seeing, So can you say what are the reasons for this epidemic of PCOS? I would call it epidemic.
Yeah, absolutely. It is epidemic and only. I'm practicing since last almost 28 years. If we can recall our childhood, only one or two fat girls were there in our school, and who were seen as some special objects by everyone, by teachers, by their colleagues, by anyone. So the incidence of the obesity was very less when we were like, it is long back, it's for 40 years back or so. The incidence of obesity was very less. Nowadays, if we see any thin lean girl, then we are surprised. Oh, there are some thin lean girls are there. Maximum girls, the school going girls, they have crossed the BMI of 23 at the age of, I think, 15 only. So obesity is becoming epidemic of our country, and therefore the PCOS. There are many causes for these PCOS. The causes for PCOS may be genetic, but to that I must add that it can be phenotypically determined disease also. There are faulty food habits in the home. Then now due to study pressures, the girls going onto the grounds and playing has decreased so much that physical exercise has practically become nil. Especially in the corona period when the students were sitting in the home and study from the home or from the laptop they were doing. There was no time that they could go on the ground and they can sweat. So obesity is one of the main cause. Yes, genetic preponderance is there, but main thing is that they have to sweat, they have to take care of their diet, what they are eating. So diet, obesity, genetic preponderance, etc. are the reasons for PCOS. And we are becoming a hub of the PCOS as far as the adulthood is concerned.
My question to you is that in last 2 years, because of pandemic, every child is sitting at home and the obesity has gone up almost by 50-70%. Is there an increase in number of cases of PCOS in last 2 years?
Yes, we are witnessing this in our OPD. That menstrual irregularities, especially in the form of the delayed menses, are coming to us. Many of the patients, and it is very much necessary as a gynecologist to diagnose this, because this PCOS will, if it is not treated, will lead to the metabolic syndrome, and then that poor girl will suffer in her adulthood or in her late menopausal age with many dreaded complications. So it is utmost important that we should pick up at that time and we should treat that obese adolescent. Treating may be easy part, but counseling and implementing that counseling at home is a difficult task, and it should be followed regularly.
Yeah, so the management is very important. So what are silent features of management that you will tell us?
First focus should be, we all know that it is in some cases it is genetically determined, but our main focus while counseling should be there, that one can get rid of this PCOS easily if tried earlier in the life. Basically, to reduce their body weight, or they should come into the balanced BMI. Balanced nutrition and diet is very, very important. Then exercises are very important. May it be in the form of running on the ground, may it be cycling, swimming, whatever. Exercises are very important. For this, we have made this 7-step. There is a 7. Sir, previous slide, please. Yep. 7-step guide is there. That whenever we come across a patient who is we suspect that she is a PCOS and we confirm it through sonography and all other investigation, we have to gently break the diagnosis to that patient. Then in a way, we have to explain her that what is PCOS, so that she should understand. There are many leaflets. Usually every gynecologist in their OPD is having leaflets in local languages. So should be that should be handed over to the patient so that they can understand the disease. We have to emphasize on the need for the long-term treatment. Patient is coming, we are giving treatment, she is getting her menses and everything, everyone is relieved. Then another 6 months, after 6 months, she will come back. So long-term treatment is needed, should be counseled. Counsel her for lifestyle modification as we discussed. Explain her different treatment options. First we will go with the diet, then exercise, then we will go to the medicines, and then to the hormonal options we will go. Then she should adapt to the therapy, and if she is going for the metabolic syndrome, she should be made aware that what are the signs of this metabolic syndrome. These are all are the things it should be. There are many PCOS clinic as well. Recently in Amravati, RIMS hospital has come up with the PCOS clinic also. So there are PCOS clinic also one can go to that clinic, those clinic, and can take help of those clinic, and they can help to modify their lifestyle, diet and exercise.
So the take home message is counseling for the lifestyle modification, diet, exercise is the most important mainstay treatment of the PCOS. This is case 2, but I think I'll take up this case later on because I think we're running short of time. I'll take this case later on. Okay. Now we'll discuss the psychosocial issues in adolescent girls. And for that, I invite Dr. Swati Madam to comment about. We all know that there are so many psychosocial issues in adolescent girls. So my question to Dr. Swati Madam is, Dr. Swati Madam, why to learn this? As a pediatrician, why you want to learn this? Because this is a psychologist or psychiatrist domain. So why should I learn this?
A very good afternoon to you, all of you. Am I audible?
Yes, please.
My sincere thanks to Satish Agrawal sir, Taide sir, and Pandrikar sir, and all the organizers for this opportunity. Coming to this question, why to learn about psychosocial issues? So as Pandrikar sir has explained in great details, what is that we have to address a lot many adolescents in our practice, because they are so huge in numbers, and everyone, may it be a pediatrician, may it be a general practitioner, may it be a gynecologist, a dermatologist, anyone is going to come across the adolescent in his practice. So 1 in 10 adolescents, they have significant problems on the psychosocial domain, and 1 in 5 have a significant DSM diagnosis, but which goes undetected. So there is huge morbidity and significant mortality, and more so in girls, because they come from the they are highly potential to get into such problems, and also they are not looked after by their parents and families as well as the boys. So we have to be really more careful about girls. There are psychiatrists, very few psychiatrists in our India, and the ratio is 0.75 per 1 lakh, which the WHO states that at least 3 per lakh population has to be there. So we have to shoulder their burden. And many do come to us with these psychosomatic problems into our practice, and they may go undetected if we are not aware about them. So by the time the child is 14 years old, 50% of the children, they will start manifesting their lifetime disorders on the psychiatric arena. And up to 75% of these disorders, which are adult disorders, will have their onset before the age of 24. So we have to gear up.
तर असं म्हणतात की बाळाची बाळ पाण्यात दिसतात, तसंच असं म्हणायला हरकत नाही की जर अडोलसंट मुलीमध्ये किंवा मुलामध्ये असं जर काही सिम्पटम्स असतील तर डेफिनेटली इज मोर प्रोन टू डेव्हलप दिस सायकॅट्रिक इलनेसेस इन अडल्टहुड. ओके.
Yes, no, and their psychiatric illnesses, they can be diagnosed. They come into the diagnostic criteria for those children under 14 and under 24 in the respective percentage that we mentioned.
Okay, that DSM criteria.
Yes.
Dr. Swati Madam, tell me why these teenage girls or teenage boys, they are more vulnerable for these issues?
So as you can see that the adolescent brain is under construction, and anything that is under construction, we know that there are lots of chances of accidents over there. So while the neurons are being migrated from one place to another, while they are being myelinated, while the synaptic connections are being made, there could be many issues that in later life manifest as psychosocial problems. So there are so many social causes. Now the teenagers are moving away from the family and facing the society. So they come across many influences which are not so good, or which are the stressors of the society, the stressors of the education system. So all these are they are undergoing, and that gives them a lot of stress. And stress in the adolescent is multifold. The same stress which would cause a simple response in a child or in an adult, it causes a multiple, a very high magnitude response in the adolescent. They are poor health seekers. They will not come to you. They will resist coming to a doctor because they see coming to a doctor as a childlike behavior. So we cannot pick them up. There is no awareness among the society as well as among the health professionals regarding psychosocial issues, how to identify them, what are the red flag signs, how to help them. And generally it is taken that yes, children, they don't have any psychological issues or any psychiatric issues per se. The preventive strategies, like for corona, we have all the preventive strategies of SMS. For TB, we have lot many things, but a vaccine or something like that, it is not there. So we have very limited preventive measures. Then girls are more vulnerable because they have to continuously adjust to the internal milieu, which is changing with the cyclical changes in the hormone system. They are also under a lot of stress and perceive stress more. They have all the disadvantages that we all know in the family, in the society, in the workplace, in the school, wherever. They don't even have good toilets. So you know what the stress they are going through, and all this makes them vulnerable.
So the girls are more vulnerable as compared to boys as far as these issues are concerned. Okay.
Yes, definitely.
Dr. Swati, madam, can you please tell us what are the different adolescent mental health disorders?
Yes. So there are many mental health disorders, and we could classify them into internalizing disorders and externalizing disorders. Internalizing disorders are those wherein the distress felt by the adolescent is internalized by him. He is not expressing it out. So they trouble themselves and they are in a silent mode. And these disorders fall into the category of common mental health problems, and most commonly seen are depression, anxiety disorders, various phobias, OCD, eating disorders, and psychosomatic complaints is also one of them. So coming to externalizing disorder, in this disorder, the child will manifest his stress on and express it onto the environment or onto the others. So conduct disorders, disobedience, ODD, ADHD, impulse control disorders, delinquency are all such type of disorders. Then also there are certain disorders which are major psychiatric disorders which do not fall into these two. These are schizophrenia and bipolar. Then substance abuse disorder is very common. Neurodevelopmental disorders in the form of autism and mental retardation, they are carried forward to the adolescent age group, and the diagnoses are missed in the early childhood. Also, there are certain disorders which are resultant of many physical ailments, especially the anemia, the thyroid disorder, and the Wilson's are very important. But one important thing that every pediatrician or a general practitioner should know, that any child who is coming with poor academic performance, we have to really give a thought whether he is suffering from any major psychological issue.
Fine. That means that internalizing disorders, they are not manifesting directly. So you have, as a clinician, have to be watchful, or you as a parent, you as a teacher, have to be very watchful, carefully for finding out these symptoms and signs of these internalizing disorders as compared to externalizing disorders. Okay. So my question to you is, who are at risk?
Yes.
Which teenage girls are at more risk?
Yes. Naturally, the girls are at more risk, but we cannot screen everyone and each one. But we should remember that these are the children who are more at risk of developing any psychosocial problems. First and foremost is the family history of having any mental illness, or the past history in the child of having any developmental issue or a psychological issue. Then those who are belonging to the socioeconomically deprived sections, conflicts in parents, broken families, nuclear families, bullied or abused children, and this is adverse childhood experiences, ACE. That is a very important criteria. Because these children who have undergone lot of stress in their childhood, in the form of having an alcoholic father, or having been bitten by someone, or having been exploited by someone, or all these things, they lead to a lot of stress response, which again manifests into psychosocial issues as the age advances. So the institutionalized children, and also the children who are suffering from chronic disorders of any sort, may it be the diabetes, may it be asthma, any other disability, hearing impairment, visual impairments, all those are very vulnerable. Those adolescents who are given lots of responsibilities in their tender years, like those who are earning for their families, or those who have started off their families, getting married, they are also very much vulnerable to these problems.
Means those who are socioeconomically deprived, like street girls or orphans, they are at a more risk of developing these diseases. Okay, fine. So can you tell us what are the gender differences in adolescent mental health issues?
Yes, there are certain differences, like the internalizing disorders that we discussed, especially the depression and the anxiety, they are much more common in girls than the boys. Depression is almost twice as common in girls, and anxiety is thrice as common in girls as compared to boys. Then these issues, they are more severe, and they persist and remain for long years with these girls. They are not easy to be treated. They always have multiple comorbidities, and during this anxiety and depression, they have multiple types of symptoms, but the physical symptoms are more commonly seen in girls. Then premenstrual dysmorphic disorder is exclusively a diagnosis for girls, as we can all see. Substance abuse is generally less seen in girls, but schizophrenia and other major mental disorders, they are also quite common in girls, but they tend to manifest at a later age as compared to the boys. But then we know that if there's a major mental health disorder, the girl or the woman is treated very, very badly by the family and the society. There is abandonment, there is cruelty, there is punishment, there is a lot of abuse. So they suffer a lot, even though they suffer little later in their lives. So these are some of the differences in between the two sexes.
Can you tell us that what is normal difference between the normal adolescence versus troubled adolescence?
Yes. So any adolescent is likely to show any mood swings or show certain behaviors which we would like to call a deviation from the normal. But any such behavior which is either a sudden change, or it is a severe change, or it is a persistent change remaining for more than 2 weeks at a stretch, and importantly, it is affecting the functions that the adolescent has to carry on. Like he's not doing good in academics, not able to keep relationships with his friends or family, not able to eat properly, sleep properly. All these things should be taken together to see that it is not a normal teenage behavior.
Dr. Swati Madam, we'll just rush to this case. In short, this is a 17-year-old girl, lives with her parents, studying in first year of college. She's not sleeping well since past 6 months. She stopped talking with her friends, avoids going out with her family members. Always she's irritable and shouting at parents, and she stopped going to dance class also. How will you approach this case? In short, can you tell us?
Yes. So we will have to take a proper Hedges history, which is a psychosocial history taking in the adolescents. It is a great detailed history. And after going through that history, we come to know what are the weaknesses in the adolescent's life right now and what are the strengths. So, and how much the problem has affected his day-to-day routine. So in this case, we could keep certain differential diagnosis as the behavioral problems of adolescence, but it is not there because this child is coming with 6 months of symptomatology. Then adjustment disorders are the disorders wherein in the new setup, the child finds a lot of trouble to get adjusted with the new environment. But such a history was not there. And also adjustment disorders get over in few weeks' time. She could be a case of depression, major depression, or she could be a case of bipolar disorder wherein depression and mania, they alternate. She could be manifesting with the depressive depressive part of their bipolar. Yeah. Also, we have to rule out first and foremost the physical causes of the health, which could give rise to such type of presentations.
The anemia, hypothyroidism, and the chronic diseases, these are the main causes that we must always rule out before we go label the patient as a mental health disorder.
Yes. And substance abuse, we should always keep in mind.
Yeah. Dr. Swati, as we are lagging behind in our schedule, I'll skip 2 cases. We'll take up if time permits. So I'll straight away go to the nutrition aspect of the adolescent girl care. And for that, I invite Dr. Rajesh Bhoop, sir, for this particular session. So, Dr. Rajesh, what is the importance of nutrition in adolescent girls?
Yes, good afternoon, everyone.
Yeah, good afternoon.
Nutrition is important for any living being, and especially so for adolescent. Why so? First of all, we should ask ourselves, why do adolescents need food? Remember, it is 3G. First G is to go. Go means they want to wander, they want to move around, and for that they need energy. Second G is to grow. Adolescence is the last and final chance to grow. We grow in childhood and adolescent. After that, there is no growth. So this is the last chance for that adolescent to grow. Third G is to glow and shine. So for this, we need nutrition. Nutrition has a profound impact on the current and future health of adolescents. Many children who have nutritional deficits and linear growth faltering generated during their first decade of life, these adolescents, if they are provided sustainable healthy diet and healthy eating practices, this can be corrected. This in turn will limit harmful behaviors which are contributing to the epidemic of non-communicable diseases. Investing in adolescent health brings triple dividends. One, better health for adolescents now. Second, improved well-being and productivity in their future adult life. And the most important, reduced health risk for their children. So it has a transgeneration effect.
Just I'll ask the question, Dr. Swati, madam. What is Barker hypothesis? Can you explain in a word or two?
It is difficult to explain in a word or two, but Barker hypothesis says that if you have suffered from malnourishment when you are in utero, you get a tendency to retain the nutrients that you get later in life. So if a fetus is born IUGR, and then if he is well fed, then he has all chances of retaining all the extra fat and everything and go into a obesity, because he doesn't have the tendency to consume, but he has a tendency to store, because maybe he is tuned to that. There could be a starvation later. So he stores and goes into a metabolic syndrome type of issue with obesity and all cardiovascular risks.
Yeah. So it's we call it FOAD. It is a fetal origin of adult diseases. Yes. So today's teenage girl is going to be tomorrow's mother. So if she's herself is not nutritionally balanced, or she's not healthy enough, then definitely her babies or her children, they are going to be a sick one or problematic one. So my next question to Dr. Rajesh is, what are the common nutritional deficiencies in teen girls?
Yeah, the most important and first deficiency is iron deficiency. As you have already quoted the statistics, around 20% of Indian population is adolescent age group, and out of that 50% are anemic. So iron deficiency is one of the commonest nutritional deficiency in adolescent in India. Iron is essential mineral not only for hemoglobin, and it has got multiple effects starting from brain to all the organs, from to GIT to intellectual. Second is iodine deficiency, which is needed for many organ function and mainly for thyroid. Vitamin D, not only for bone, but it has got many effects apart from bone mineralization. B12 deficiency, apart from hemoglobin synthesis, are needed for myelination of brain and nervous system. Calcium, bone, as well as cardiac activity. Vitamin A deficiency is a significant factor in pregnancy. Magnesium goes in hand with calcium. So these are the commonest nutritional deficiencies. The most common is iron, and I am finding folate is missing in this. Folate deficiency comes immediately after iron deficiency, before iodine and vitamin D.
So what are the common eating disorders in adolescent girls, Rajesh?
Yeah, you already mentioned bulimia nervosa and anorexia nervosa. Okay.
Yeah, can you explain them in short?
Definitely. These are very long topics. I will be just covering the salient features of them. I will be mainly highlighting the differences between anorexia nervosa, bulimia nervosa. Binge eating disorder is mainly a psychological problem, and many of us consider it as a variant of anorexia nervosa. I will be comparing anorexia nervosa and bulimia nervosa head to head. Anorexia nervosa, mainly the symptoms are related with keeping the body slim and thin, and the efforts are constant. The eating pattern is practically monotonous and it is being followed the day and day out, and there is worsening in the eating pattern. On the contrary, in bulimia nervosa, they pretend that they want to become lean and thin, but they have episodes of binge eating, and these binge eating episodes are quite consistent and regular. And to overcome this binge eating, they use cathartics or vomiting as a solution, purging as a solution to reduce the weight. The different how we can differentiate clinically. The anorexia nervosa patients are mainly lean and thin. They can be normal, and bulimia, they can be normal, but they are more towards obese side. They get pain in abdomen. Anorexia nervosa patients get pain immediately after eating, and the bulimia patients get pain after they vomit it out. The complications, the outcome in anorexia nervosa, if they are diagnosed at early stage and managed at a better center, 80% have got significant recovery. While bulimia nervosa, the outcome is not so good, or the statistics is not easily available for bulimia.
Thank you. My request to Chairperson Dr. Shalaka Madam and Convener Dr. Satish Sir, please, we are already overshooting the time. Can you please allow us the 10 minutes extra? Satish Sir?
Sure, sir, you may take, sir. Sure, sir, you may very well take, and it's very interesting. It's going on.
Thank you.
Excellent, excellent, sir. Please continue.
Thank you. So just, I have displayed the slide. I think Dr. Pranjal Madam has very nicely elaborated that obesity, hypertension, all those things are related with the PCOS. And of course, obesity is entirely a big topic. In fact, I had one case, but because of time constraints, I'll skip this case. One case for a case scenario for Dr. Rajesh ji. This is a 14-year-old Priyanka. She's having history of easy fatigability, irritability, generalized weakness, poor scores in studies. She has poor appetite, and she has history of repeated infections. She always likes junk food. And of course, she has regular and normal menses. There's no history of GI bleed, no history of melena. On examination, she has pallor, RR is 30, she's always irritable, tachycardia is there, spleen is 2 centimeter palpable, and bradycardia is there. How will approach clinically this case?
Okay, so definitely it is a case of anemia. Okay, and the symptoms are attributed to that. The only thing is that she has got normal menses. There is no menorrhagia, no GI bleed. Okay, spleen is palpable. We can get palpable spleen in iron deficiency too, but we have to search for additional causes like hemolytic anemia. Platiniciac goes more in favor of iron deficiency. So definitely I will be doing CBC and will be getting what I expect or not. So the MCV and MCH are low, and I expect that MCSC will be low. RDW, though not mentioned, I expect a high RDW.
Yeah.
So it will be a classical case of iron deficiency anemia. And if the CBC is showing this picture, possibly I will be not doing any investigations right now. And I will start iron in appropriate doses, and the dietary modification like correction of junk food and anti-helminthic are to be given. And the iron, after starting of iron, I will be repeating reticulocyte count, and if it is rising in a week, possibly I am managing rightly. Hemoglobin I will be doing at the end of 1 month, and I expect a rise of 1 gram hemoglobin, and I will be completing iron therapy of total 4 months. If the patient doesn't improve in any of these parameters, possibly I will be doing hemoglobin electrophoresis for this patient.
Okay, but what complications you expect in this patient if not treated?
So anemia is just not a simple decrease in hemoglobin. It has got long-term complications as well. The long-term complications include CNS complications, and they can be permanent at times. All the complications of CNS due to iron deficiency anemia, if they are long-standing, they may not be corrected 100% with correction of anemia. So iron deficiency has got effect on every organ of body.
So with this, I'll come to the end of the session, and there's some echoing going on. Somebody has logged from joined from two devices. Okay, now I want to know about the take-home messages from Dr. Swati Madam. Please tell us what are the red flag signs for difficult teens, because you have talked of various psychosocial aspects of the problems of the children. So what are the red flag signs which as a pediatrician, which as a parent, which as a teacher, I must try to find out in every adolescent girl?
So any issue that is lasting beyond 2 weeks, may be feeling very sad or not mixing with people, issues on appetite, sleep, or even weight, then deteriorating scholastic performance, it is a very strong red flag sign. Involvement in fights, like not keeping relationships with the siblings or with the friends, self-harm, violent behavior, aggression, then not eating or using laxative as we have just now discussed, poor concentration and attention, like not being able to focus on the activities and also on the academics, not participating in any routine activities at the school or in the family, and looking anxious, worried, are all the symptoms which we should be very careful about and not let them just go as teen blues.
So the most important message is that any of these red flag signs is occurring more than 15 days or 15 days, then we should suspect the some of the psychosocial problems or psychological issues with the adolescent girl. Now my next request to Dr. Pranjal Madam, what are the take-home messages as far as the menstrual health is concerned? Unmute yourself, Pranjal Madam.
Am I audible, sir?
Yes, please go ahead.
India is a country of goddess. So since the birth or since the childhood, we should make the child aware of her femininity, and we should inculcate the qualities that the girl should celebrate the family, her femininity. She should be well aware of her femininity, and she should always celebrate her femininity. For that, there are certain things like she should be following the healthy menstrual practices. We are the one who are going to teach her the healthy menstrual practices through our seminars, webinars, through our social organizations, etc. The girl should keep proper menstrual record through. There are many apps available. They should try to keep their proper menstrual record. For example, her age of menarche, then every year her menstrual cycle pattern, etc. They should keep through various apps, or simple if they want to do it in the black and white. There are many various books are available. They can keep those records. So this is also one of the important messages that adolescent girls should follow. Safe menstrual hygiene is one of the things through various methods like sanitary pads or clean clothes, or nowadays menstrual cups. They should opt something. They should go to their gynae and they should take advice for safe menstrual hygiene. Also, all the girls should be made aware of what is proper BMI, and through diet and exercises, they should keep their body mass index in proper shape. This has, as we discussed, that this has long-term implications on their health. Awareness regarding contraception is also very much important part nowadays, because teenage pregnancies in adolescence, they are now uprising, and we have to deal with these things. So the best thing is the stitch in time. So we have to teach them proper contraception methods. Also, I would emphasize on that we have to teach them on various aspects, that they should not start these sexual practices etc before certain age, and their harms about that. But at the same time, considering the irresponsible behavior in some adolescent teens, we have to make aware of the contraceptions to them. Also, the act of the POXO should be made available for reading, or letting them know about the POXO Act, because this is one of the act where if they are found guilty, then the tag of that thing will be on their head for lifetime. So they should be made aware of these things. So these are some take-home messages I would like to give to adolescents.
Thank you, madam. So they should have proper BMI, proper diet, exercise, and proper lifestyles. And of course, at the same time, we must tell them that they should not go for zero figure. What was a fashion a few years back, zero figure. They should not go for that.
True.
Also, it is also one of the important message which we should like to give them. Now, my request, Dr. Rajesh Bhai, can you please tell us the few take-home messages as far as nutrition is concerned?
Definitely. The messages are very short, but they are important. We should limit our total carbohydrates to 50%. And out of that, 10% of total energy, maximum, should be from free sugar. So minimum of free sugar. The energy intake from fat should be around 30%, mainly with unsaturated fats to be preferred over saturated fats, no trans fats, decrease in salt intake, foods to be avoided which are high in fat, foods with added sodium and sugars, mainly the processed or canned food, they have got sugar more and salt. We must avoid the bakery products. The homemade foods are definitely good. As far as peer groups are concerned, we have got many social outings, and whenever we go to somebody's place, we have snacks, we have extra meals that adds to our calories. As far as school is concerned, they must restrict celebration of birthday to maximum one birthday per month, because with birthday comes chocolates and cakes, and they are harmful to children. What is a standard diet? It has to be followed at home also. We cannot preach adolescent. What we practice, the adolescent are going to follow. No eating in front of TV, no eating while searching WhatsApp, and proper exercise has already been highlighted by Dr. Pranjal Sharma madam. Government must control advertisement of various junk foods which are harmful to adolescent. School canteens should not allow selling of junk food in their canteen or nearby vicinity. And as far as the purchase of packets are concerned, we must follow a traffic signal approach. There should be marked red, green, and yellow depending on the nutritional value of that content. And adolescent must see the signal and then only eat that particular product. Avoid cold drinks because they are very high in sugar. Yesterday only I read that fruity has got around 65% of sugar, fruity. And our simple lassi, what we think Amul lassi is good, it contains 30 to 35% of sugar. So we must read the contents before eating or drinking. The best beverage, no energy drink. The best beverage to drink is our simple plain water. No fruit juices, eat raw fruit.
At all ages, no?
It is applicable to all ages.
At all ages.
And as far as carbohydrates are concerned, the whole grain should be prepared. The food should be eaten as raw as possible. And I think what is applicable to adolescent, it applies to all age group, including our age group. That's all.
Okay, thank you, Rajbhai. So the take-home message from your this thing is that you should avoid junk foods, and as a parents, we must stress more on homemade foods and whole grains. So with this, we come to end of this panel. And first of all, let me thank organizers Dr. Satish sir and the chairperson Dr. Shalaka madam for giving us the extension of time of 10 minutes. Let me thank the today's esteemed panelist Dr. Pranjal Sharma madam, Dr. Swati Ghate madam, and Dr. Rajesh Bhai for excellent discussion on this topic. I know, friends, this was a very big topic, and I hope we have done justice, or at least on these three aspects of the adolescent healthcare. There were many cases, but because of short of time, we could not conduct all other cases. So once again, thanks to Satish Bhai Agrawal sir and the IIP Amravati. And lastly, I would say that प्रयत्नांचं धैर्य लावून प्रयत्नांचं just let me share the screen. Prakash, can you please allow me to share my screen? Last slide. Is the one saying?
Yes, sir. Please share.
Okay. Sorry. Yes. प्रयत्नांचे नवे पंखे लावून स्वप्नांच्या नव्या आकाशी सैर कर. साथीला गे धैर्याला अन आकांक्षाची नवे शिखरे तू सैर कर. हे एक आव्हान मी आजच्या या अडोलसंट गर्लला करून आज मी ते थांबतो. वन्स अगेन थँक्यू व्हेरी मच.
Thank you so much.
Thank you, sir.
Thank you very much. Over to Dr. Shalaka madam or Satish sir.
Dr. Shalaka ma'am is visible. Shalaka ma'am. And we have with us the observer, Dr. Vaishali Vyavhari ma'am. Dr. ma'am, would you like to say something? Dr. Vyavhari ma'am? Dr. Vaishali ma'am? And final two words from Dr. Tuteja sir. Sir, are you there? Dr. Tuteja sir? So before we hand over to again the session in charge, Dr. Abhijit Morwal, my personal thanks to the moderator, Dr. Jayant sir, and all the panelists. Over to Dr. Abhijit Morwal sir.
Sir, Tuteja sir has joined.
Tuteja sir?
सर मैं गई नहीं था कहीं.
अरे सर, प्लीज आपके दो शब्द सर.
सर मैं क्या बोलूं, कुछ वर्ड्स ही नहीं मेरे पास. It is beyond words. The way the session has been conducted, the way the topics has been chosen. मुझे नहीं लगता, पता नहीं कितने महीनों से आप लोगों ने इसे सोचा होगा और इसको बनाया होगा, इन्हें कोई एस्पेक्ट छोड़ा ही नहीं है. The best speaker, best people, best organizer, all the best for the future also. I really enjoyed from morning to evening and listening to everybody, and really it was superb. Great to all the organizer and especially to Satish, and taking so much care from so many years and creating name of Amravati IIP. All the team members are excellent and doing a fantastic work. Thank you so much for inviting me.
Sir, if I am allowed to say, only two things I want to learn. First thing, the credit goes to the teamwork, sir. Even Dr. Jay sir, Rajesh sir, all our team, they have done extremely well, sir. And second thing is the tendency to learn from you. You are sitting right from beginning till end. You are there, sir. So that is a great thing to be learned from you, sir. Jay sir, आता तुम्ही बोला.
Sir, really thanks to Tuteja sir. Sir, hats off to you, and thank you. Just thank you are the two words, but it carries a lot of meaning for that. Thank you very much, Tuteja sir. And of course, hats off to Satish Agrawal sir for organizing this today's wonderful CME involving every topic on the woman. When I asked sir that how can I talk of adolescent care in just 1 hour or 40 minutes, he said, no, we have to cover we have to cover every aspect of the woman, right from infant girl to the geriatric woman. And really hats off to you, sir. You have covered even the physiotherapy aspect of that woman also. So really, once again, thank you very much to you, sir, and whole organizing team. Thank you, Satish Agrawal, sir. Once again, thanks.
We have Dr. Rajesh Bhog, immediate Vice President of Maharashtra IIT. Rajesh bhai. Rajesh sir. No, not visible. Swati Ghate madam is there. Now, madam, you are not no more a panelist, you are an expert. So your expert comments.
Hare. Thank you so much for this honor. I'm really humbled by all the respect and kind words you have been using. And it is just such a great pleasure to share dais with such august people like Tuteja sir, and he is our guru. And what to say about him? There are no words to me. Sir has been so very kind to us, always a guiding force. And sir, lots of pranams to you, sir. And हम आज so whatever we can do, it's only because our gurus like Tuteja sir and all the others in our Adolescent Health Academy. And as sir has rightly said, Amravati has been doing wonders. I had the opportunity to come to Amravati digitally a couple of times earlier also, and I really appreciate. And Satish sir is rocking, and Jayan sir ki to kya kehne. So thanks to all the organizers and for congratulations for this wonderful event.
Thank you.
मैम आपने हमारी सबको भाव में एक साथ में प्रदर्शित कर दिया। हम लोग भी सर को गुरु मान के पैर छूते हैं सर के।
बिल्कुल सर, तो मतलब सर के लिए सही में शब्द नहीं है।
राजेश सर
नहीं है, सब लोग आपसे बच्चों से सीख रहा हूँ।
ये बड़प्पन है सर आपका, आप ऐसी बातें बोल देते हैं।
ऐसा है कि मैंने कहीं पढ़ा था कि when you say that I know everything, you are the most foolish person in the world. When you say that I don't know, it means that you still want to learn many things in the life. So I always say I don't know. Because I want to learn from children because they are coming up with the latest knowledge. And when you observe their body may, the way of talking, and the research they do for the topic, and bring the so many excellent slides and latest data. So that encourages you also to do something when God has given you opportunity, He has given time. At any age, God has given you time. Utilize that time for the what you have learned from the society, from the country. Give it back to the country because it is your country. You are loving your country. The country is giving you so much, has given you so much, giving you so much. Why not to give to the others so that they can learn and they can grow up? And everybody should get the time to grow.
Yes, sir.
I am also going to do only thing, then it is the finish. The things are finished.
Sir, if you allow me to share the experience you told me, Dr. Tuteja sir was at US some time back. And when anybody goes to US, he goes for the tourist spot, moving here and there. And what sir was doing, like he was going to the library, searching for the books, searching for the topics, and he was preparing the slides. It's really a teaching lesson. It was as he's saying, I'm always in learning mode. Sir, इन्होंने जो आपको गुरु बोला, आप रियल में गुरु हैं सर।
चेला बनने में मजा है।
राजेश भाई।
यस। अब टुटेजा सर ने जो बोला उसके सामने कौन क्या बोल सकता। सर ने जो बोला है वो आदर्श अगर हम लोग फॉलो करें कि एक अच्छा डॉक्टर वही है जो जिंदगी भर सीखता रहे। सर इस उम्र में सीख रहे हैं, ये हमारे लिए सबक है और वी विल बी लर्निंग एंड वी विल बी फॉलोइंग हिज पाथ। थैंक यू एवरीवन।
वेरी गुड राजेश।
थैंक यू।
अंजय शर्मा मैडम अपने साथ में ये 5% OBGY सोसाइटी। Now, madam, you are no more the panelist. Your expert comment.
Sir, thank you very much. Thank you very much for making me part of this panel and allowing me to share my thoughts. And more on, sir, thank you very much for today I can meet a person, Dr. Tuteja. I am very much impressed. It is due to these gurus that our medical profession is so much enriched. Lot to learn from. Thank you, Satish sir. And of course, sir, Dr. Satish sir, Dr. Pandrikar sir, and Dr. Rajesh Gupta sir are always inspiration for us. We follow them, and they're always like they're having their hand on our head, and they're always like blessing us yes, you go ahead and we are there with you. So thank you, sir. Thank you very much for everything.
Dr. Sarita Kaur ma'am, you are there?
सर
Sarita Kaur.
सर मेरा वो इसका चल रहा था ना वो
Arpita Paskaude.
अमरोजी का वो जस्ट हुआ
Dr. Jain sir has acquired, like we had included a topic on physiotherapy and it was good. So credit goes not only to the topic, but the person who spoke on the topic. And that was another the very young Dr. Arpita Rathod Paskaude. Dr. Arpita, are you there?
Yes, sir. Yes, sir. Good afternoon to one and all. Thank you so much, Dr. Satish Agrawal, sir, and all respected dignitaries for giving me such a big opportunity. I hope I did present it well. And it is an honor to listen you all. I'm very small right now, but I'm like in front of you all. But sir, I enjoyed it thoroughly. And it was a great CME presentation. Thank you so much, sir. Thank you, ma'am. Thank you, sir. Thank you.
So if nobody else has to say any word, then we proceed to Dr. Abhijit Morwal, sir, the session in charge, and my dear heartfelt thanks to Dr. Abhijit. Dr. Abhijit. Unmute.
Dr. Abhijit, your voice is breaking.
There might be a network issue. So I'll start with my vote of thanks. I'm Dr. Sushil Rajput, Secretary of the IIP Amravati. Albert Einstein has once said, the only source of knowledge is experience. Thank you everyone for sharing your experience and decorating our diagnostic and therapeutic mind. I thanks to our chief guest, Dr. Uday, sir, Dr. Renu Boralkar, ma'am, for their delightful presence. We are thankful to all gorgeous and awesome chairpersons, Dr. Bobde madam, Neeta Mundada madam, Dr. Lakshmi Bon ma'am, Dr. Sarita Kadu ma'am, Dr. Jyoti Agrawal ma'am, Meenal Deshmukh ma'am, and Dr. Shalaka Bari ma'am, whose presence make us happy and energized our CME. We also thanks to Dr. Convener, Dr. Satish Agrawal sir, who is a root or we can say heartbeat of this CME. Without him, this CME was not possible at all. We also thanks to moderator, panelists, and senior most members like Dr. Satish Tiwari sir, Dr. Jayant Pandrikar sir, Dr. Tuteja sir, Dr. Nishikant Kotwal sir, Dr. Rajesh Bhuk sir, Dr. Pranjal Sharma ma'am, Dr. Swati Gate ma'am, and Dr. Seema Sune ma'am. Their experience and guidance strengthens our ethical and moral practicing in medicine. We thanks to all speakers who conceptualize our thought process by explaining in a very simple manner. So thank you, Dr. Hari Mangtani, Dr. Nitin Raut, Dr. Sonali Shirbate ma'am, Dr. Panet madam, Dr. Nagalkar ma'am, Dr. Vikram Wankhede, Dr. Abhinav Darwade sir, Dr. Arpita Pachkaude sir ma'am. We thanks to young and dynamic host Dr. Rishikesh Ghatod and Dr. Abhijit Morwal for carrying this CME in a buttery way. We also thanks to Mr. Prakashji and his team for backing us in all technical work without any hesitations. And lastly, thanks to lovely audiences. Without their support, this CME was not possible. With everyone's permission, we end this session. From my side, from our team, IIP Amravati team 2022. Thank you.
Thank you once again, Tuteja sir, Satish bhai, Pranjal madam, Dr. Swati madam, and Sushil bhai.
Thank you. So we look forward
Thank you, sir. Thank you.
For such support in future too.
Thank you, sir.
Thank you so much, and namaskar to all.
Namaskar. And if